John can come when we'll add him as a later presentation if necessary. So today, I'll call the CHAB meeting to order. Thank you everyone for being in attendance. I will start with a salute to the flag, and I'm wondering if Bill Sims can lead us in the salute to the flag. Okay. Then I will ask Dana Searcy, will you lead us? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, Madam Clerk, will you please call the roll?
Of course. Alexis Hill, Chair.
Here.
Mayor Lawson, Vice Chair. Bob Lucy, I believe, is on his way. Naoma Jardin, Councilwoman.
Here.
Devin Reese is on Zoom, I believe.
Here.
And Charlene Bybee, filling in for Christopher Dare on Zoom.
Here.
And for the record, Madam Chair, you have Herb Kaplan as your DA today. You have a quorum.
Thank you, Madam Clerk. And we will go into public comment. And do you have the first name?
I do. Public comment is limited to 3 minutes per person and may pertain to matters both on and off the board agenda. First up, we have Megan O'Farrell.
Hi, good morning, everyone. For the record, my name is Megan O'Farrell. Thanks for having me today. I wanted to talk today about some concerns I have with the CARES campus and some of the ways with which the people who are under county care right now are being treated. The folks who are outside in the SAFE camp have just recently experienced a pretty detrimental winter event with the atmospheric river that came through our community a week ago. And per your buying slip to purchase the Mod Pods, you have all recognized that those tents are not adequate for people to be outside in right now, especially with the colder temperatures that have been happening for several weeks. I know that you are transitioning into taking over this responsibility, but what I'm asking for you today is to make some decisions that can help support people right now while we wait for those Mod Pods to come. One of the suggestions that has been made to this group and to the City Council, because we know you've been going back and forth in terms of who is in responsibility for this, is to put those folks into a motel program until those Mod Pods can arrive, to at least support them with some kind of safe space until we have a better solution in the works. So I encourage you to come up with some kind of right now plan to support these people who are outside living in pretty horrific conditions. I also would like to address some concerns that there is not an appropriate way for people who are staying in these facilities to express grievances. I've been told by several folks within the county and the city that there aren't any problems, but I can tell you that if you go to the Mutual Aid Facebook page, you will regularly see folks from both the CARES campus and the SAFE camp asking for basic supplies like jackets, blankets, pillows, batteries, things to stay warm that we are continuously being told are being supplied. And the answers that we get when we advocate for these folks is that there's a way for people to say that they need these things and no one's saying anything. So there's a clear breakdown of communication that's happening between your organization and between advocates and the people who are being directly affected. So I would like to ask if there is a possibility to be able to put together a community advisory board that is consistent of living experienced folks who can actually advocate for these things themselves without having to directly come between all of us all of the time. Because this back and forth that we're doing to continuously say, well, they said this, but you said that, is not helping anyone. It's not helping us get any solutions brought to the table, and it's not supporting the people who are living in these spaces right now and are trying to survive. They are under our care. They're under your care. We're using our tax dollars to pay to keep these people in traumatic situations, and we need to do better. And so I ask that we please come up with a grievance policy that can actually be addressed either anonymously and has actual follow-up so that people feel like their concerns are being heard and addressed and not being left to figure out how to ask for resources from the rest of the community on public forums that they're embarrassed to do and having to share these stories over and over and over again. So I please ask you to take some time to give these people a little humanity. Thank you.
Next up, we have Monica Dupuy.
Good morning. My name is Monica Dupay. I'm an advocate for homeless youth and founder and director of the Nevada Youth Empowerment Project, a local nonprofit serving young women who would otherwise be homeless with the self-reliance housing-based teaching model. I have been advocating for homeless youth in Washoe County since 2007. I and ENYEP have also led 9 of the past 10 annual homeless youth point-in-time counts for the city of Reno. I and ENYEP have also been attending Washoe County's Built for Zero meetings for close to a year now. Built for Zero is the program approach the county has adopted as our approach to ending homelessness. Built for Zero is a national model. It's not something new we are producing. We are simply adopting a proven and effective model and implementing it locally. With that said, I'm here today to point out some inadequacies in our efforts towards building the effective continuum of care that we need for homeless youth, as well as some opportunities for us to do better together. Number 1, is our homeless youth shelter really operating as an emergency youth shelter? What is the intake criteria? What is the assessment and referral process? What is the ban and suspension policy? Every agency should have this readily available so that we understand who is served and who is not served. It's okay for a youth shelter to operate a workforce housing program, but it must clearly identify who each program serves, so we can ensure HUD-identified homeless youth are effectively being served. I'm concerned they may not be. Number 2, only youth who are defined by HUD as homeless should be entered into the HMIS. Youth accessing workforce training and support should not be entered into the HMIS. Youth shelters should have a psychiatrist and psychologist on staff. Anywhere from 50 to 90% of the homeless youth have mental illness and will need to be stabilized through medication management before they're able to add more responsibility to their lives. An MFT is not sufficient. The youth shelter must acknowledge the adult shelter is sheltering many of the homeless youth and fix the duplication of credit in the HMIS system. Youth shelter staff must be trained in administering, scoring, and referring using the VSPDAT assessment tool. Number 6, the county's Built for Zero team is currently piloting the case management approach that will be used at the CARES campus with transition-aged youth entered into HMIS, since it is the smallest population in the system. The Built for Zero team must take that last leap and lean in more. Open the VSPDAT screening documents, discuss how the scores came to be, what program options are available, what's the program's placement criteria, and which specialized housing will we need to build to empty the shelter. This is how we solve homelessness. We cannot treat our shelters as destination points. As paid leaders and providers, we have little to no skin in the game. We get paid whether people overcome homelessness or not. We must adopt a spirit of working together on this. Who of you will spearhead to ensure that this work is getting done? And I'm also willing to help. Thank you.
Next up, we have Lily Barron.
Good morning. My name is Lily Barron, for the record. I'm a policy associate with the ACLU. I'm here today to also express concern for the unhoused community in your care. As some of you know from meeting the last few weeks and through email correspondence after the last few months, it was brought to your attention that tents at the Safe Camp were inadequate for inclement weather. It is unacceptable that in a place with a multitude of stores where you can purchase weather-appropriate gear that could have been purchased before this weekend storm, that was not done. Instead, that weekend was a disaster, and it was inhumane and negligent, knowing what we already knew about the gear that was made available. We are at minimum requesting the following be put in place. Please provide weather-appropriate tents or a motel program and personal warmth items for the Safe Camp, preferably that is verified by an outdoor expert. The grievances at CARES campus also to be submitted anonymously so that folks can actually communicate their needs and that they are addressed with a physical receipt. Now that shelters are consistently at capacity, there's an even more urgent need for women, especially who feel unsafe at CARES, to go to an alternate location. It is an urgent need, especially for women, to have equal access to safe shelter, and CARES is not suitable or safe for women as it stands now. There is no need for these folks to continue to suffer when there's a multitude of solutions that are not yet implemented and unprecedented amount of money being spent on this issue. Further, these meetings being canceled in times of crisis further exemplify a disregard for fellow human beings, and I would recommend making up these meetings and possibly adding more meetings to satisfy fixing all of these issues. Please treat this as a public health crisis and take immediate action. Thank you.
Next up, we have Jake Maynard.
Good morning. My name is Jake Maynard for the record, and I'm here today to speak about the dire situation regarding the treatment of our unhoused neighbors. So far, since the transferring of homeless services to the county, we have seen much of the same negligence and lack of considerate planning that puts people's lives in danger. For example, the almost complete lack of winter preparedness, specifically regarding the safe camp, is extremely distressing and has put people's lives in danger. This is something that we attempted to bring attention to well before it became an emergency situation as it is now. In the purchase order obtained in a public records request for modular pods aimed to provide adequate shelter from the weather for those at Safe Camp, it says, quote, needed due to public emergency, current emergency situation based on homelessness population in winter weather that could result in death or injury at Safe Camp under current tents being used, end quote. As advocates, we foresaw this being an issue and attempted to communicate the necessity for winter preparedness. Those modular pods are still not present at Safe Camp, and people are still actively in danger due to inadequate shelter. These emergency situations arise when the problems we present to the board are ignored or are not taken seriously. Something I would also like to bring attention to is, according to the yearly listing for this committee's meeting on the Washoe County website, the August 23rd meeting was canceled. There was no listing present at all for a September meeting, and the October 4th meeting was also canceled. These meetings are regarding matters of literal life and death, and in my eyes, 3 months of absent meetings is absolutely unacceptable. If you are unable to commit to a monthly meeting of such importance, then maybe you shouldn't be on the board in the first place. I ask you all to do better and to, in the future, to take these concerns and suggestions more seriously so that we can avoid future emergency situations. Thank you.
Katie Calling.
Hello, can you hear me? Okay. So my name is Katie Calling. I'm a co-founder of Rise. I was the free market director for 7 years. Currently, I manage a community garden. We grow food for Washoe Food Not Bombs, a pantry, and the community in general. I was going to ask you politely to fully fund Rise's efforts to open Record Street for women, to provide warming centers for people living outside, and to pay special attention to Monica's points about the Eddy House. They're very well thought out, so hopefully you'll hear them. However, it's obvious that you think you've done enough, and you don't take us seriously. Because we don't know the minute details of your poorly thought out plans, you treat us like uninformed children. So let's put 2 and 2 together. Our community tore down hundreds of affordable housing units in the last 5 years, hundreds. And our homeless population tripled, if not more. And you're still treating it like personal failures versus structural poverty. I would argue, and hear me out on this one, the people in positions of power are the uninformed children. You're welcome.
Bill Sims.
Morning, members. If any of you guys have seen me speak as city council, prepare yourselves. So, of course, my name is Bill Sims, and I'm here along with my fellow advocates to let you guys know that essentially, you guys need to stop placing the blame on the city and vice versa. You guys are in control now. You guys are supposed to be helping people at Safe Camp, CARES Campus, on the street. The city put that on you. You chose to take it over. So with that in mind, when I emailed you, Alexis, about that man literally sleeping in the sleeping bag in the dirt, and you emailed me back, you said nothing about him. And I have the email, so I can show you where you said nothing about that person. In regards to people at CARES Campus, they aren't safe there. I've had women actually come up to me and tell me that they may not have been sexually assaulted there, but they have been sexually assaulted, dropped off back there, and VOA security looks at them and says, well, we don't give a damn. Be on your way. You're not allowed to be here right now. And in regards to Safe Camp, I have actually personally overheard that people can't even speak out about the things they are experiencing at Safe Camp in fear of retaliation against Grant Denton. And given his manhood, I would expect that to be true because of how I had one interaction with him and he blocked me on Facebook. One civil interaction and he blocked me. So I really think that you guys need to get off your asses and help our homeless community. If the city is not going to do it and they put it on you, then you need to do it. And to Jake's point, if you're going to cancel these meetings constantly, then every one of you need to step down because you don't care for anyone except the elite that are moving into Reno that can afford $2,500 a month in Reno. And if it were up to me, I would remove every one of you and actually put people on the streets in your positions because they sure as hell would appreciate helping people more than you guys do. Thank you.
Bridget Turnan.
Good morning. For the record, my name is Bridget Tevnin. Thank you all for hearing me today. I think I echo a lot of the points made by my peers and fellow advocates today. I would like to, I guess, first start with the urgency of providing an equal and safe space for women. This has been brought up multiple times at city council meetings. I think it's worth this board hearing it as well, that women are not safe at the CARES campus. Our place is consistently full, and the reports of assaults need to be taken seriously and heard by each one of you. The women deserve a separate space where, in addition to the trauma of living without shelter, they're not subjected to physical and sexual violence. Again, the grievance issue at the campus needs to be addressed. A lot of it is hearsay right now about what that process looks like and if grievances are actually being heard. But I would like to see this board specifically addressing that process and seeing that grievances are being addressed and that there's no type of retaliation happening, that there's some type of process in place so that people aren't afraid to bring concerns forward. Along with that, I think that some of the recommendations that come from John DeCarmine need to be seriously considered, specifically the training of staff. I think we're seeing this all across our county services, that people are not being paid adequately or trained properly to handle the intensity of kind of the situation that the community is in right now. So we really need to be looking at proper training for people and compensation. And finally, something that hasn't really been touched on yet and that I wait with bated breath to hear from you all today is your plan for what is going to come after CARES, and that's affordable housing in this community. We're increasingly seeing housing just being an opportunity for people to make passive income, and everyone deserves a right to shelter in this community more than their second income. Thank you all.
Next up, we have Isla Arbatman.
Good morning. I'm here to speak to the fact that this board is illegitimate, undemocratic, and ineffectual until it incorporates a lived experience component. Undemocratic in the sense that the people serving on a board like this, right, need to, the people experiencing these problems need to be represented on a board addressing these problems, right? There's a reason that the Reno City Council is not made up of Las Vegas residents. Even if those Las Vegas residents were very well informed about what was happening in Reno, they would have absolutely no connection to the consequences of their decisions, and therefore that board would be undemocratic and pointless. Similarly, this board is ineffectual because it has no lived experience component. You could have a group of very smart English professors on the Planning Commission for capital sewer projects. They might have a lot of really great ideas, but when it came time to implement those ideas, I'm sure you would see a lot of problems related to the fact that they had no experience in that particular field. A case in point here, in June of 2020, RISE brought a safe camp proposal, right, to the CHAB, at which point advocates were told that a safe camp would never happen here. Here we are about a year later, and still, rather than listening to RISE, right, and paying attention to the people that are actually informed about these issues, we continue to see the same pattern, right? Ignoring them until it becomes too late, bringing them in when it's kind of an emergency situation, and then continuing to ignore them after that. A lived experience committee is not that complicated to form, right? It would be actually pretty straightforward. In fact, at the Safe Camp, there is a resident advisory board. I'm sure some of you are familiar with that, and that is a great step in the right direction. However, I'm not really seeing those people here. I'm not really seeing them actually being invited to the table. When I say a lived experience committee, I mean people who are consistently coming to these meetings and being invited in the spirit of constructive collaboration. Coming to make public comment, as a lot of people here know, right, it feels like you're just, basically screaming into the air, and maybe somebody might give you a nod or acknowledge what you're saying, but that's not the same thing as being invited to the table. If you were truly genuine about the mission of this supposed board, right, there's absolutely no reason why you couldn't have a group of lived experience people. And by lived experience, right, what I mean is people who are currently living on the street or have lived on the street, who know the problems faced, who know what it might take to get out of that situation, right, and who would be informing your decisions and be able to actually make this body more effectual in the long run. Good first step would be the resident advisory board at the Safe Camp could be invited on a regular basis to CHAB to share their thoughts and share their concerns in a forum where they feel like they're actually being heard. That seems fairly straightforward, and seeing as this body, I think, has the leeway to institute something like that, I think that should happen at the next CHAB. Thank you.
Madam Chair, I have nobody else signed in, and let the record reflect that Commissioner Lucy is in chambers.
Thank you, Madam Clerk. And thank you, everyone, for your public comment. We will next go, do we have John DeCarmine? Oh, wonderful. We'll go to item 4, board update and discussion on the Nevada Cares Campus Service Plan recommendations. John DeCarmine, JD Consulting, LLC.
Hi, good morning, everybody.
Morning.
Let me pull up my screen. And if you'll give me 1 second, I need to quit and reopen. I had to just update Zoom. And so to share my screen, I just need to launch the application again. I'll be right back.
Okay, we'll wait just a moment for John.
Wouldn't it be nice if we had some soft elevator music or something? Some soft elevator music, you know?
Okay, apologize for that delay. Okay, is everything up on your end?
Looking good.
Okay, great. Well, thanks so much for the opportunity to be here this morning. By now, I hope you've had the chance to go through the recommendations report that I had put together. My name is John DeCarmine. I work with JD Consultancy. I'm also the executive director of a large low barrier homeless shelter in Gainesville, Florida, that has done a lot of the work that the CARES campus is looking to move towards. So I'm really excited to share the overview of the recommendations today, and then to answer any questions that you have about what I've put together. So just to start with a little bit of background, one of the highlights, one of the things that I really tried to draw attention to in the report is that the work at the CARES campus has to be designed to meet the needs of the unsheltered homeless population in the city of Reno and Washoe County in general. Amid an 875% increase in unsheltered homelessness over the past 4 years, what you have started to see on the Truckee River, on Wells Avenue, and in other places is hundreds and hundreds of people with no place to go and no homeless service system designed to meet the particular needs that folks there have. So the risk of not designing the CARES campus specifically to have low barriers to bring in as many people in as possible is that it's not going to meet the needs of the people who need it most. So as we're going through this, I want you to just keep that in mind so that we can see how we can tailor the services to be as effective as possible so you can start to see the reductions in homelessness that you're looking for. Quick bit of background on the process. I've had the privilege of working with the Washoe County team over the past several months. Had the opportunity to come out to Reno twice to tour the CARES campus. At that time, I've met with service providers, met with frontline staff, met with program managers and leadership. We've worked to develop some policies and procedures, and then also had spent a lot of time interviewing people who were living unsheltered at the time to try to figure out what it would take to get them to come into the CARES campus, whether that was the Safe Camp or the emergency shelter. And then just back in September, I had the opportunity to provide 3 different 4-hour training sessions with the frontline staff of both the Safe Camp and the emergency shelter. Throughout that process, what we have seen, what I have proposed is a phased implementation of the CARES campus to really address the problem, the risk of the campus getting too big too quickly. And if that happens, when that happens, the risk is not only that you could lose public support for the campus among people who might be future funders, future supporters, but even bigger than that is if this campus is not safe, if it is not well-staffed, and if it is not designed to meet the needs of people currently living without shelter, you're going to end up with a lot of people who come in, try the campus, and then decide that it's not for them. So with that in mind, the first phase needs to really be focused on creating a safe environment particularly at the emergency shelter. We have done trainings on how to make sure every conversation is about housing. Emergency shelters can and should always meet basic needs when they can, but all of those basic needs should also be used as opportunities to steer people towards housing services and housing placement. And then the implementation of a diversion program is going to be another substantial piece of that. I'll move over to phase 2 in just a minute, but with that, that's really just fleshing out the campus, making sure that the needs of the people coming in for services are able to be met, and that the needs of the provider are able to be met in terms of them having appropriate facilities, appropriate levels of offices and meeting spaces, basically facilitating their work to meet the needs of the people that they're serving. And from there, moving into phase 3, which is the development of on-site permanent supportive housing, and very specifically permanent supportive housing, but not transitional housing or some other housing intervention that won't actually end somebody's homelessness. So in that first phase, again, maintaining a safe environment, it is going to be impossible to separate safety from the level of staffing and the level of training that your staff has, particularly, again, in the emergency shelter. With the capacity at the Safe Camp right now, it at least has given the providers some opportunities to build rapport with people, to get to know what they need. And as I understand it, there've already been a substantial number of people moved out, which also allows opportunities to move new people off of the street and into the Safe Camp. On the other hand, looking at what is happening right now in the emergency shelter, I think it would be generous to say there's half of the staffing that is currently needed, but the situation there that the staff are dealing with, I don't think they can reasonably be expected to do anything other than jump from one crisis to the next and put out one fire after another. There is, quite honestly, about half of the staff that you need in that emergency shelter. So with the goal of maintaining a safe environment, that has to come down to doing whatever it takes to bring in the right people and putting them in the right places, making sure that they are paid adequately so that they can support themselves for doing what is very difficult and very challenging work, and then making sure that they have the training and the leadership to not only be providing that safe environment, but particularly to be working with people once they get there to get them on the road to housing, get them back into housing as quickly as possible. With the current situation, and we'll talk about length of stay requirements in just a bit, but by and large, people have come to the shelter once and they've stayed there. And it is operating very much like a hostel, so that people are coming in, they are safer maybe than they had been in their unsheltered situation. They may have better access to services, but without any movement for them to actually exit homelessness and get into housing of their own, all we have done is create a place for 600 or so people to live. And then there's no opportunities for this to be a tool to actually get more people off of the street and into shelter, because quite honestly, the people who are currently in the shelter are not leaving the shelter. Another big piece that needs to be implemented is diversion. Very briefly, diversion is a service that looks to see what other housing resources somebody might have that would prevent them from needing the emergency shelter. Many times this takes the form of bus tickets. If you can confirm that somebody might have a brother or a sister in another state where they could stay, once you've confirmed that they have a safe place to stay, you can arrange transportation for them. In other cases, people may show up and find out that we find out that they had been staying someplace previously, and there's only a very little bit of support that's needed to allow them to continue to stay there. But without that program, we end up filling the shelter up with people who could have been prevented from needing to be there altogether. In a good diversion program, you can move about 1 out of every 4 or 1 out of every 5 people who are coming in for shelter services into housing before you even need to give them a shelter bed. So that has 2 benefits. 1, it gets that person housed immediately. 2, it preserves a very scarce resource, and that is an available shelter bed for the next person who would be coming in who truly has no alternatives. Moving to phase 2, that's the development of campus amenities. Ongoing enhancements to safety and security are absolutely necessary, whatever it will take to allow the campus to meet the basic needs of the people who stay there. Because again, people are going to be coming in And just as the community right now is deciding how they feel about the CARES campus, whether it's something worth supporting, the unsheltered population is making a calculated decision about what is most likely to help them meet their needs. And if it's not a safe space and it's not a place where they can get their needs met, then you're going to end up with an unsheltered population that either can't or won't go into the emergency shelter. Additional needs there is a place for people to congregate, a place where service providers can meet with shelter residents, and then also, as you heard this morning during public comment, some additional needs for severe weather shelter. I think it's very telling that during the wildfires a few months back, even when the people in the safe camp were offered the opportunity to move into the emergency shelter, not one person had decided that it would be better for them to move into that emergency shelter than it would for them to stay outside and risk whatever health hazards may have come from the smoke and the fires. Finally, in the third phase, looking at that, again, the research consistently shows that for people with higher needs, whether those are physical or mental health needs, supports for addictions, anything like that, permanent supportive housing is the most consistently reliable intervention that we can provide for people. So as you're looking at that third phase, I know there have been some conversations about whether it should be used for permanent supportive housing or perhaps transitional housing, but all of the research supports the inclusion of permanent supportive housing into this plan to allow for exits from homelessness. Solving homelessness is one of those things that's very simple, but it is not easy. There are two ways that two components of the flow of a homeless service system. People are coming in the front door of a shelter, they're arriving homeless, and then there has to be a back door that they can exit from to get out of the shelter and to exit homelessness. Permanent supportive housing is the best way to provide the supports that people need to end their homelessness. So really, not to put too fine a point on it, without more staffing and without the right staff being there, the well-trained, well-paid professional staff, it will be almost impossible to maintain the safe environment that would be required to provide a trauma-informed space for people. As a general goal, you want to be looking at about 4 staff for each shift, and that's for every 100 beds. So for a 600 bed capacity, that would be about 24 staff per shift, so that people have the opportunity not just to be de-escalating or to be, moving people from one place to another, but actually to be speaking with them, to communicate about housing, to learn about what it will take to get them off the street, and to keep your shelter guests engaged and moving along on that housing process. I know that there has already been a gate installed so that there is controlled entry and exit to the campus. That is a great step forward. Easy to follow expectations are another big piece of this. The more work we can do to make people feel welcome and safe in the shelter, the more likely they are to come to that shelter and take advantage of the services, as well as to share information with other people they may know who are homeless, that it is a place worth checking out and a place where they feel they can move from homelessness into housing. So a lot of that takes the form of ongoing training, not just in conflict resolution and trauma-informed care, but also conflict de-escalation, motivational interviewing, harm reduction, overdose response, and finding ways that the staff can be prepared and feel safe themselves while providing services to the population that you're serving. To the length of stay policy, that is going to be one of the biggest changes that you could make. Right now, there are 600 people in there, and just based on my knowledge of other homeless shelters around the country, it's safe to say that at least 50% of the folks in there have some form of income. It may not be sufficient to afford housing in Reno, considering the housing market there, but it's a start where we can begin to work with people and begin to look at how to leverage other resources in the continuum of care to make sure that they're connected to either rapid rehousing or permanent supportive housing. But without that length of stay policy, people generally don't have the momentum toward housing that they would if they knew that there was a deadline or basically a limit on how long they could stay. And the example that I used when training the CARES campus staff, I asked how many of you, if a teacher had assigned a book report that was due, but they didn't give you an end date on when that report was due, how many people would actually start working on that book report today? And maybe 1 or 2 hands out of 30 went up. And then as you asked, well, how many if the deadline was given 4 weeks from now, and a few more hands went up, and if it was 2 weeks from now and more people chose. But ultimately, when you implement a length of stay policy to let people know that momentum toward housing is not only expected but required, you can end up working with people at a higher speed and with a little bit more involvement from the actual shelter resident than you would if you just tell people to start working on housing when you feel like it. So we want to create a situation there where people come in and maybe they have a day or two to decompress and relax and feel safe once they finally got a bed and a place to stay and some meals in them. But at the same time, we need to make it clear that this homeless shelter is not just the destination where somebody has gone to be homeless forever, but instead it's a part of the process to get somebody off of the street and back into housing. The final piece of this is making sure that the shelter and the safe camp policies are aligned. And that's just going to prevent shelter shopping, where people will generally go from one place to another, trying to find a place with policies that are the least restrictive. And if we can keep the shelter and the safe camp policies the same in terms of length of stay, in terms of the requirement that you're working to the best of your ability on a housing plan, and keeping with general expectations to facilitate the safety and well-being of everybody else using the program, then you'll eliminate that risk of people bouncing from one place to another, and they'll stick with the program that they have access to. There also is a strong need for project performance measures, particularly as you're looking to see if the providers that you're working with are in fact the best ones to be operating these programs for the county. The best project performance measures that we'd be looking at are not ones that just count how many people were served or how many nights of shelter were provided, but instead looking at ones that have the greatest impact on actually getting people off of the street. Specifically, that is showing up in how many people are being moved from homelessness to housing on a monthly basis, how many people are being diverted from homelessness, and the general goal for that is about 20 to 25% of people showing up to the shelter should be able to be diverted after that program's had some time to grow and mature and staff has gotten really good at it. The housing retention rate, once we end homelessness for somebody, how long does that last? And that's generally measured as a ratio of how many people were moved into housing today who have not returned to homelessness in the next year. And then looking at reductions in the length of stay in shelter. So for the shelter that I operate in Gainesville, Florida, the average length of stay for somebody who is successfully exiting to housing is about 42 days. We set a length of stay of 30 days, and we tell people that as long as they are working on a housing plan to the best of their ability, we will extend that shelter stay on a week-by-week basis up till 90 days. But again, we had previously run with a 90-day length of stay, and as soon as we dropped that length of stay to 30 days, back to that book report example, we saw our housing placements go up by about 20%. So it's simply putting that deadline in there and then collaborating across teams to work with people to do everything we can to get them into housing. That's why homeless shelters exist. It's not just to warehouse people in a big cavernous space, but instead it's to get them in there and then work to get them out of there as quickly as possible. A couple decision points that will fall to this board and other leadership for the project. First is the shelter capacity. Again, the current environment is unsafe. We want to be looking at a minimum of 4 staff for every 100 beds per shift. For case management, we need to have a caseload of about 1 to 30. When I was there at the end of September, I want to say there were 9 case managers for 600 people. So that this is about half of the caseload that we currently have people working with. We all understand that the people, there has not been enough work to create services for unsheltered, chronically homeless people in the community for the years leading up to this. This is not something that happened overnight, but likewise, that means that the people who are showing up to work with the case management staff at both the Safe Camp and the emergency shelter have a higher level of need in terms of physical and mental health problems than somebody who just became homeless yesterday. So the appropriate case management load is really no more than 1 to 30 to give the staff the appropriate amount of time and engagement to work with people to end their homelessness. Finally, as you consider what best ways to use the existing facility, it makes a lot of sense to establish smaller zones. The size of the emergency shelter is unmanageable given the number of staff that you have. And so one of the recommendations that I had made was that you consider not only increasing the number of staff, but then reducing the physical plant size of the space that they are responsible for. So specifically, instead of having 1 or 2 rooms with hundreds and hundreds of beds, that those rooms are partitioned, and then one team of 4 is working with only 100 people. And then another team of 4 is working with a section with another 100 people. And that gives people time not only to get to know people and to find out more about what it is that they need, which is information they can pass on to case managers or diversion specialists, but that rapport helps with everything from housing engagement all the way through conflict de-escalation. In general, anecdotally, 80 to 90% of conflicts can be de-escalated before they even start, just by having staff who know and are familiar with the situations of the people in the shelter. So if you've got 4 or 8 or 10 people right now who are just kind of running around from one flare up to another among 600 people, if you can cut that number of people who they are responsible for and who they get to know down to a much smaller number, you'll see improvements in not only safety and security, but and reductions in the number of conflicts and crises that are popping up. As you look to using the additional funds that, as I understand it, there's some conversations about tens of millions of dollars to be spent on improving the campus itself and the physical facility. I would urge you to consider using at least some of those dollars, not only to pay staff more, to hire more staff, to do everything you can to retain staff in a very challenging environment, but to consider whether all of that money needs to be spent on the emergency shelter, or if it instead could be used to create some additional affordable housing. Again, back to that front door and back door component. If people don't have a place to go that they can afford, they will not be able to successfully exit the shelter. So there may be some opportunities there to carve back some of those facility improvements for the emergency shelter and instead prioritize additional creation of affordable housing. Beyond that, the key needs that we heard speaking with frontline staff were the need for flexible funds for diversion, funds that are immediately available as somebody shows up in an office. If we can buy a $200 bus ticket to get them to family in California, those kinds of things need to be able to be addressed immediately, and they need to be built into the budget as immediately accessible, flexible funds. Likewise, the opportunities for rapid exits from shelter go up dramatically when there are funds available for first month's rent, last month's rent, security deposits, and things like that. We're running a pilot program of rapid exits from shelter in our facility right now. And in the first month, and ours is 146 beds. It is a much smaller facility, but proportionally, we had put aside about $20,000 a month just to cover first month's rent, last month's rent, security deposits, because we knew there were a substantial number of people in shelter who could get into housing if we could knock those barriers out of the way. In the first month of setting $20,000 a month aside just for those kinds of uses, we saw our housing placements go up 80% from the previous month. And finally, looking at ways to support and subsidize additional affordable housing, not just permanent supportive housing, and then finding ways to support the staff so that when you do have the right people there, how can we make sure that they stay there and carry some institutional knowledge into the opportunities to train the next group of people who come in. And just to wrap up, in terms of what some next possible steps would be to improve services on the CARES campus, in the course of training frontline staff and case managers last month, it seems that there's a substantial need to overhaul the case management process so that it's not only acutely housing focused, but it also is a collaborative effort across all teams. So it's not just case managers who are working to get people into housing, it's frontline staff, it is people who are helping serve meals, it can be volunteers, it can be leadership. But overall, the way the case management process works right now seems to be primarily set up in silos, and with an overhaul of that where there are adequate chart reviews and case conferencing and ways to be involved with a person from the day they show up until the day they leave into housing, there would be, again, substantial improvements in the number of people you would see exiting homelessness. Implementation of that diversion program at not just the first time somebody shows up to the shelter, but every single time they are entering or exiting into a bed. Adding additional trainings, and particularly with staff turnover, creating a set of baseline trainings that are required at onboarding. So you know at minimum that when people in crisis are showing up and asking for assistance at the CARES campus, that the staff responding to them are able to do that in a very professional, trauma-informed way that facilitates the ability to meet the needs of the person there, as opposed to just finding opportunities to bump people out of the shelter because they did not meet an expectation. Clarifying employee expectations is another big piece of this, and that is tied to the folks who work on the campus understanding that it is a privilege to serve the people who are there and who have come in and said that they need services. Making sure people are never yelling, making sure that when people show up who are already in crisis, that there's nothing happening from staff that might re-traumatize somebody or make it more difficult for them to receive services. And then also making sure that the team knows that there are good ways to respond to conflict. There are bad ways to respond to conflict. Some of those ways can help de-escalate situations, but what we see in homeless shelters, unfortunately, is a lot of overworked, underpaid, untrained staff. And sometimes they respond in ways that can escalate a situation. And that ultimately doesn't affect the staff member so much as it does the person who is told that they are no longer able to receive services there. And then ongoing work to implement that strong housing focus, which is, again, really driving home the point that the shelter is part of the process to get somebody into housing. And it's not, in fact, a destination, because as we've seen, if 600 people show up in the shelter and there's no movement to get them out of there, then you suddenly have hundreds and hundreds of other people on the street who you're hoping that the shelter will serve, who literally can't get in because nobody has left the beds that were initially filled up because of that lack of housing placement. I know that was a very, very brief overview, but with that, I want to just make sure I leave plenty of time to answer any questions that you have or share any additional information you might like.
Thank you,
Thank you.
John. I will go to our board to see if there's any questions or comments. Yes, Councilwoman Jordan.
Thank you very much, and thank you for that very thorough presentation. I do appreciate all of the feedback. There was some very candid and information that I think we knew to a degree as we opened the campus we would be facing, and I appreciate all your expertise in that. I do have a question, though, with regards to the staffing and the need for additional staffing, increased pay for attraction and retention. We at the City of Reno, I don't know, 4 or 5 months, a few months ago, allocated, I want to say, some $400,000 or $500,000 for this exact reason. So I'm curious if that didn't help or how it helped in any way. We knew that there was a need for additional staffing and we allocated monies towards it. So I don't know what the status of that is.
And that's a question for VOA, correct? Or
Yeah, yes.
do,
And I don't know if there's
Kate-
someone from VOA here who can
Right, I
address
don't
that,
see
because
anyone.
we saw that at the
Right.
opening, that there was the need for additional staffing, and I'm curious where that stands. Now, I will say this with an asterisk, everybody is having difficulty in hiring. Every sector, every business, everywhere. So, but I would like an update on that.
Sure, thank you. For the record, Kate Thomas with Washoe County. Last we understood, those dollars were going to VOA for bonuses. I think instead of a salary increase, it was an enticement for the staff. And so we'll get an update from VOA.
It was both.
Okay, we'll get an update from VOA as far as how those were applied to the staff that exists and how they're using it to attract new staff. I know we discussed it a little bit, but because it was a Reno action, we weren't entirely sure how it got directed through VOA. But we'll follow up and get that to you guys.
Is there nobody from VOA here?
I don't see anyone. They might be watching, but
Okay, that's a problem.
yeah. I'll reach out to them.
Thank you, Councilwoman. Do you have anything, Mr. Mayor? Mr. Chairman?
No, thank you, Madam Chair. I as I sit here, and listen to the presentation, and very much, as Councilwoman Jordan pointed out, it's very extensive and very candid in regards to what we expect and what we need and what we're looking for in regards to moving this and truly finding that mission of not just shelter, but truly a path and a way forward for individuals, that are incurring this challenge of homelessness. And so but from my understanding, what feels like what we just received in that presentation is information that was given to us 4 years ago, 3 years ago, before we started this, when we hired the firm from Reno, and I can't remember, I'm sorry, I lost track of their name, but we spent quite a bit of time, Madam Chair, Ms. Councilwoman, when you were chair of this board, and it seems like that information is still the same. So I'm interested, and I realize that Mr. Carmine is providing us that information based upon the current setting. But I also want to make sure we also realize that this is just brand new. This isn't. We're not even a full year into this campus, the management. And it's really trying to, as you pointed out, employment is very difficult right now for every sector. We are still trying to acknowledge that we have some challenges. I just want to make sure, and I think it's part of the discussion later in this is really kind of on agenda item 6 is to have that, what is that future mission for this board and for the region to identify what are those objectives? Now that we've got a facility, how do we properly manage it? And I think we do have a team, a staff of individuals that are out there really truly trying to grasp that information, collect it from individuals like Mr. Carmine and his organization, and truly evaluate what we can do to better evolve the program. However, I still think this needs time. And I understand we have immediate needs, but I want to be talking about what are the long-term needs? What are we really focusing on here at this organization? How can we, because just to get this to fruition, this campus to fruition, what the hoops we had to jump through and the money that we had to things that we had to do was significant. But we are still working to identify staffing issues, security issues, and best practices for operations. So I appreciate everybody's hard work and diligence into looking into this matter. However, there's just not enough data yet to really truly evaluate, because I feel like the data we're just being presented this morning is the same that we were presented years ago. And I really don't see any difference yet, other than we have a campus now that we can evaluate that's only been open for 6 months. So I have some hesitations about making comment one way or the other. I just want to make sure that we're moving in the right direction and that we're not getting bogged down in the problems that we have today, but that we're still working towards a mission of solving this or trying to provide paths forward for individuals. And look, everybody who sits on this at this dais and all the staff that works on this and even all the community involvement, everybody's going towards the right direction. It takes time. This is not something you just flip the switch and change. So those are my comments, Madam Chair. Thank you.
Thank you, Mr. Chairman. It looks like Councilman Reese has some comments.
Yes, thank you, Madam Chair. And Mr. DeCarmine, I haven't had the privilege of meeting you yet. I am the newest member of this body, so I just want to ask some questions very specific to your experience. And as I understood it, you have essentially are a bit further along in your particular facility than we are here as a region. But I want to sort of come back to some of the comments made by Commissioner Lucy about time frame and the reasonableness of our action. So what is a reasonable time frame for a community of our size to act on these type of items? And we have some immediate needs. You heard advocates this morning talking about some of the weather events that we've had. I am very concerned, as is everyone on this body, about the winter, which is already here. The rain was very difficult. We had about a year's worth of rain in 36 hours. Our ultimate opening of this facility was, I think, in many ways, a Herculean undertaking that only really happened because of the confluence of a pandemic, some federal dollars that came to our region from the federal government. And of course, as you know well, governments are very slow at times. We don't do anything fast, which is something that I've had to learn as an elected official. So I'm trying to understand what you see as, I mean, yes, you've identified some immediate needs, and those largely, as I understood the proposal, center on staffing, but some of the more long-term needs you talked about were about housing. And until we understand housing as infrastructure, and until we start building such housing, I am sort of at a loss to understand what are some of the ways to implement the concerns that you've raised, because I agree that having a facility but with no exit strategy really is not what any of us had hoped for or were looking to do. But now we have to shift our focus, I think, as a region to that next piece of the puzzle. But it takes time to build housing. So kind of those are my thoughts. I'm just sort of trying to get your thoughts about the reasonableness of a time frame. We want to be responsible and responsive to folks who are experiencing homelessness. And so how do we get there? Because as Chairman Lucy was sort of indicating, this is not a new concept. We have been discussing it for a while, but now is the time for us to take up the call to action. So just some thoughts, if I could.
Sure, and pleasure to meet you. I'll look forward to meeting you in the future. So the good news is, well, it's bad news, but every community has a shortage of affordable housing. There is a disconnect between the wages that people can generally earn and how much housing costs. And that may be a bit more severe in your community, but it is not something that other providers have not found ways to work around. In my community, we've seen homelessness go down by 47% since 2014, which is when our facility was created in order to address a lot of these needs. And in fact, we've seen unsheltered homelessness go down 68% since 2014 by delivering services in the ways that we have outlined here. And we were not there at year one. And I try very hard as a consultant to balance the needs of the local governments who I work with and the communities who I work with the very real, very raw understanding of what it means to be an under-resourced provider who is trying to meet these needs in very challenging situations. That said, one of the things that I have a concern about is at some point, the way services are provided now become the way services are provided from here on out. And this is the way that becomes the philosophy of serving people. And right now, quite honestly, the staff has not had the chance to deliver a lot of higher level services because they are very much caught up in just running the day-to-day place, staff filled with hundreds and hundreds of people in crisis. And that doesn't leave a lot of opportunity to work with people. I have two children. I would not ever send them to a summer camp where there were 4 people who were counselors with 600 other people there. But that seems to be what we've created at the emergency shelter. So with that in mind, certainly 6 months from now, you could see massive improvements in the way case management services are provided. And you can be considering if the staffing levels that exist right now if the right positions are being utilized. So maybe it's not that we need all frontline staff. Maybe there can be 1 or 2 people whose job it is to build relationships with landlords and to find opportunities to create new pathways out of homelessness. That said, just because hiring is difficult right now, there are 2 variables that would play into that. One, of course, is the number of staff that are available, but the other is the size of the shelter and the number of beds. And so it's not an either or that we can't change anything until we have more staff. It's that the staff who are there need to be well trained. And then that other variable is if the staffing level that's there now is appropriate for a smaller number of beds, that's a consideration that could be looked at as well. Overall, I think this is not a lost cause by any means. There are homeless shelters all over the place that are still trying to catch up to what the best practices are and what research is showing works. And the CARES campus is no different. It's just going to take some time to get the staff there who are able to see the success of these changes to the service philosophy.
And let me ask a follow-up question, if I may. You indicated that there was a fair amount of housing on the other side of the sheltering resource in your community. How is that housing being constructed? Meaning, is it a public-private partnership? Are private developers building it? Is the government or the county, city, state in your area doing that? I mean, how is that coming to be?
I think there's a lot of similarities between Florida and Nevada in terms of how limited tax dollars are applied to social services. And some of that comes from whether we consider affordable housing, as you said, like infrastructure, or as some kind of charitable component of what local government does. So in our community, we have no abundance of affordable housing. We have, in fact, a pretty critical shortage that's driven by a transient student population and a massive overbuild of $1,500 to $1,800 a month apartments when the people who need it most are making 30% of less or less of area median income. So what we have been able to do is try to get creative with building relationships with landlords. And while that sounds simple, we often find that case managers spend as much time case managing landlords as they do the people that are actually coming for services in the shelter. And we are available to any landlords 24 hours a day, 7 days a week. We have explored paying double security deposits, or in instances where somebody is getting a resource with rapid rehousing or permanent supportive housing, we can go and approach that landlord and ask, normally this individual would not meet the requirements that you have, whether that's a credit score or no eviction history or something. But if we can pay for 6 months of rent up front, or 12 months of rent up front, would you consider adjusting those barriers so that somebody can get in? And understanding that people with mental health and substance abuse problems move into apartments every day. The difference is when we are moving people out of the homeless shelter and into your housing unit, you can call us to help you resolve any issues. And so there's some art and some science to it. There are a number of communities that have developed great programs. In terms of the affordable housing development, I would certainly say the biggest resource available right now are the CARES dollars and now the American Rescue Plan dollars. There is a strong priority for affordable housing projects, which is what led me to ask that you all may want to consider if there are tens of millions of dollars available, that maybe expansion of or further development of the campus may not be the best way to use those dollars, considering that those are already more or less pre-authorized for affordable housing development.
Yeah, I think you raise an important point about how communities use those dollars. Of course, when we set up the CARES campus, we had some pretty significant limitations on how those funds were used and the timing of it. And so we've had, a lot of concerns about the cost of purchasing the land, setting up the facility. And we did that in about 100 days, as you recall, because we had those significant constraints. I think some in the community would have liked us to have, purchased housing with it. It really wasn't an option at the time. And so now as we move forward, I think for our part as a region, we're going to be collaboratively working with our sister city and the county and figuring out how we can really view housing as infrastructure. For my part, and our body has this conversation a lot at the city of Reno, there is a general belief that as the city moves away from the sheltering component of this equation, that we'll be able to turn our attention more closely to housing, and the Reno Housing Authority and the county, I think even last week, have made some determinations about long-term housing issues near adjacent to the campus that may be changing. And so I thank you for your insight into that. And I'm looking forward to the other members of this body and our regional governing bodies having those important conversations, because I don't think that any of us believe that we have an unlimited source of funds, as you said, to be viewing these through the lens that you talked about, which is, I don't view it as a charitable undertaking. I think that's perhaps some kind of 1920s kind of look and see. But I view housing as a fundamental human right, and therefore housing as infrastructure makes a lot more sense to me as a council member, because it views the overall component of that as an equation to what people are experiencing, and then makes that examination related to their permanent housing. I don't think anyone in this body has a generally divergent view that we need more housing here. We're like you. There's a glut of, $1,800, $2,500 a month studios going throughout town, but we don't have developers who are coming to the city saying, we want to build low-income housing. I think we have one regionally. There's literally one developer of such types of housing, and it is a nuanced approach, because that housing has to be layered with so many different kinds of home funds and federal credits and state credits that most people do not want to be involved in that. We also do not have, and I don't believe Florida has, inclusionary housing allowances. So we cannot force developers to build that which we think is more beneficial. They have, certain property entitlements, and they build what they want generally on the land that they have. So I'll be looking to your experience, and also I'll sort of follow up offline as to what you think are good community examples of where they're really doing it right. I think we're at the beginning of a process. I think we can be a model community, but we're having lots of growing pains that we have to acknowledge. Having been down this route now for the last year and a half, we certainly can have done things better, and we certainly have better to do.
Absolutely. And I appreciate your perspective on that. One other relevant example in my community, Gainesville, Florida, initially the city and the county had shared financial responsibility for the development and the operation of the low barrier shelter. And so in our world, that was a $1.5 million commitment split equally between the city and the county. Over the past 3 years, and I'm not sure how your community is set up, but constitutionally in Florida, more or less the county is responsible for providing social services. The city is responsible for being involved with housing. And as the city took on greater financial responsibility for the homeless shelter, the county in turn matched that with an equivalent investment in permanent supportive housing. So at this point, the city puts $1.5 million toward the shelter every year. The county puts $1.5 million toward permanent supportive housing, and that allows them to work with existing housing units where they can pay landlords. Generally, it functions as a master lease, but that gives you a starting point right there. The rough estimate in my community, where fair market rent is around $900 a month, is about $15,000 to $20,000 per unit of permanent supportive housing per year. The risk of not getting started on this quickly, though, is the longer we let people stay on the street, the higher their needs get. The more we spend as a community for all kinds of inappropriate public health costs and public service dollars, public safety dollars. But at some point, there is a number of people, and it's around 800, 750 to 800 in your community. If we can get those folks off the street and into housing, then we can also be using the emergency shelter to prevent anybody else from becoming a chronically homeless, a long-term homeless person. But until we get that backlog of chronically homeless people solved, then we continue to create a queue where other people cannot get the support or the help that they need. So really, there is a solvable number in this, and it is your current unsheltered homeless population. And even within that, a subset of which folks are particularly vulnerable, which ones are chronically homeless, and who can we get into permanent supportive housing to empty out the shelter so that somebody else who becomes homeless tonight doesn't need to wait 3 or 6 or 9 months to get access to services. They can be helped immediately.
Thank you.
Madam Chair, if I
yes.
may.
Madam Chair.
Oh, Councilwoman Bybee, and then Mr. Chairman. Okay, Councilwoman Bybee, go ahead.
Okay. Thank you, John, for the presentation. So much great information, some really good points that I fully agree with. Really looking at diversion is something that makes total sense. And I mean, if that can reduce your people even being entered into the shelter by 20 to 25%, that makes sense. The establishing right up front what the length of stay policy is, I think, is critically important, because that gets everyone invested, you know, our clients, as well as all these, you know, case managers, the whole system moving to move them through and into solutions and permanent supportive housing, which, as you said, opens up to people that, you know, can come into the shelter and that we aren't leaving out on the streets. I do have a question on the housing, what you were just talking about with the housing component. When you say permanent supportive housing, in my mind, we're thinking about, you know, we can't get anybody to build affordable housing and workforce housing here. But I'm kind of getting a sense from what you were just talking about with the additional funding and source of funds, if you can work with landlords of existing housing that is not affordable for these clients, that maybe that is something immediate, because we do, well, and again, we do have a shortage everywhere, but looking at what facilities are here and funneling support for each client as we move them through the system, is that kind of part of that solution as you move towards supportive housing, is just simply augmenting or supplementing what a lot of these clients do have a source of income. So is this a way of also maybe moving things faster, because you can get people into an apartment? The landlords are happy because they know they've got someone to come to if there is a problem, but it's opening that door. Is that one solution?
That is absolutely correct. In fact, the permanent supportive housing that my agency operates, we don't own any of it. It is all through master leasing, where my organization signs a lease with a commitment to pay rent for 12-month periods, which also allows us to move people in even more quickly since that lease is already signed. And then the individual that is moved in is asked to pay 30% of their income. Sometimes their income is zero and they pay zero. Sometimes their income is $1,000 a month or $1,500 a month through a VA entitlement or through a Social Security check, and in which case they would pay up to 30% of that. Historically, communities often talk about the shortage of affordable housing, and that's what it is. There's no shortage of housing in communities. In my community, there are 19,000 vacant apartments. There are literally 25 empty apartments for each person on the street, but those units are not affordable to people. So permanent supportive housing, particularly given the massive growth of chronic homelessness that your community has seen, is an immediate response where you don't need to be, you can be building and developing your own permanent housing down the road, but an investment in permanent supportive housing today would allow shelter staff, outreach workers, and others in the community to begin immediately placing people and ultimately saving the community money by not having to use those inappropriate public health costs.
Perfect. Thank you. I appreciate it.
Thanks for your question.
Mr. Chairman.
Thank you, Madam Chair. Mr. DeCarmine, when you came and toured our facilities and put together your visits and data, did you have an opportunity to visit the county program, Our Place, our women's shelter, women's and family shelter?
I did, absolutely.
Okay. And I guess my question is that did you feel that model was something highly functional that you believe in regards to placement from your standpoint, in regards to something that could be somehow altered and replicated at the CARES campus?
Yes and no. There are important distinctions between facilities that are designed to meet the needs of women and children and families and those that are designed to meet the needs of single adults, particularly in terms of the number of barriers that are in place that would either allow somebody in or might prevent somebody from receiving services. So for example, at a low barrier shelter for single adults, it is very easy to serve people who are actively using drugs or alcohol, people who have some kind of sexual offense in their criminal history, people who have other extensive criminal histories, because everybody there is an adult over the age of 18, whereas that might not be, or certainly not appropriate if you're designing a facility that would serve individuals as well as families with children. There are a lot of components of our place that seems to be working very well, but I will be right up front and say I have been focused exclusively on the CARES campus. I did get a tour of our place, but I don't have as robust an understanding of it as I do the workings of the CARES campus at this point.
Okay, and I would absolutely agree with you. I think that the challenges on the housing market as well, and a point you make here in Washoe County between the cities of Reno and Sparks throughout the Truckee Meadows, extensively, we are limited on immediate housing and low barrier housing for individuals. That shortage, as you pointed out, is across the nation. The county put together and has, with the help of the cities, to a housing trust fund, not only to help with Reno Housing Authority, but also with developers to incentivize and procure land and continue on development. Have you seen those programs in Gainesville? Do you have anything like a housing trust fund that you have been witness of that has been effective, or any surrounding areas in Florida?
We have, at the state level, we have a housing trust fund that's funded through dock stamp taxes that is historically targeted the wrong level of affordable housing. At our community level, we have some community land trusts that are in there. One that's in its infancy that's designed to work with affordable housing, another one that is more for preservation of natural areas. What the primary thing you need to watch for with those trusts is who is benefiting from the affordable housing. And just for a brief bit of context, even if you look at affordable housing programs from the U.S. Department of Housing and Urban Development, looking at a line graph, it would show you that there have been consistent, if not growing, levels of support for affordable housing. But who that affordable housing support targets is critically important here. For the most part, those housing programs target people who look like me, a relatively middle class, making $40,000, $50,000 a year, and it's a first-time home buyer assistance place. So it's other ways to make my own existing housing more affordable. But when you start to look at people who are making minimum wage, or people who are getting by on a fixed income through retirement, Social Security, or disability, they're making much, much less than that minimum threshold to access those affordable housing programs. So any program that is designed with the needs of the lowest income members of your community in mind would succeed, as long as there is that understanding that it's not just it can't just start at people who are making $40,000 or $50,000 a year.
Okay, thank you. I appreciate it, Mr. DeCarmine. Thank you.
Madam Chair?
Yes.
Thank you very much, Madam Chair, and I will be brief. And thank you again for all of your detail. I think it is worth noting that, and we have another presentation which I think will probably help us to frame some progress being made on a number of different fronts. I see that Pat Cashel is here with VOA, so maybe he could answer a couple of the questions about the staffing. Because I see it as two different things that we're wanting to address. The first is to have maybe the county and VOA come forward and speak about the safety issues at the campus, because to me that's the most emergent right now, that we need a better understanding of what is going on and how we most on a short term are addressing that. But I think it is important for context. We knew when we formed this body that there were many rungs on the ladder that were missing, completely missing. We knew our emergency shelters were over capacity. Consistently, we had tents and buildings as overflow on top of overflow on top of overflow. We knew we had a once-in-a-lifetime opportunity with a 120-day time span to help one rung of the ladder, and that was the emergency sheltering. We are hearing here today, and I think we anticipated it, that there was going to be growing pains and issues in which we were going to need to address at the Nevada Cares campus. So there's lots of components of this. I don't believe today we're going to probably get into a lot of the meat of the longer-term solutions because we just simply don't have time. But it's those short-term safety issues at the campus as the next phases of it develop and help to address some of those issues of my most concern as I sit here today. So I don't know if that's a county or Pat or somebody could speak to the safety components, what you're experiencing and how you're addressing safety on the campus. Thank you. Dana.
Thank you.
For the record, Dana Searcy, Washoe County. I do not believe that we're prepared to share some specific examples with you. I think that overall the safety at the campus is a huge concern to all of us that are working there. I think the true staffing deficiencies that we are seeing, not only because the campus is so large and needs the appropriate levels of staff and the appropriate types of staff, but also because we are having such an issue filling the positions that you already have planned for in the budgets that have been approved. So on a, kind of a two-faced front here, we are working to address staffing. In the next presentation, we'll share with you that we are working on a staffing plan. We're doing everything that we can. The county is working on, just hiring fairs, and I know VOA and Karma Box, and I'm sure that RISE is also doing that. We're doing everything that we can. These jobs, I passed by a Starbucks the other day and saw in the window, hiring $13 to $15 an hour, and that's exactly what we're paying at the shelter. So it's something that we all need to look at. And for us, one of the things that we're really looking towards is how do we keep people safe while we are also growing and expanding. I mean, to Commissioner Lucy's point, this is a very long-term project. This is very new, and it all takes a long time to develop. You all appreciate if I had a perfect staffing plan put in front of you today and we said go, it would take us a year before everything was in place and all of those people were hired and trained and we were seeing the benefit of that work. So it does take a really long time. The feedback that we're getting is a lot of safety concerns and therefore increased calls to 911. And so for us, addressing that and making sure that, when we're seeing REMSA called multiple times a day and law enforcement called multiple times a day for things that really should not escalate to the point of needing a 911 call, but to the point that John DeCarmine is making, our staff is so few right now that collecting things like data or de-escalating something that turns into a crisis is just not possible. So I think that's where we're working through a lot of just how can we address staffing to mitigate those immediate safety concerns. How do we make sure that we have policies in place for when a crime is reported, what happens? Is it happening right now? We're calling 911 and getting support. If it's not, how do we document it and help that individual follow up with law enforcement so we can get that to be fully investigated? So we've kind of got a lot of different channels going, documenting everything, getting policies in place. Again, this campus is growing, right? We've started with this, to your point, wonderful effort to get the campus open. So now we're open, we've got a safe camp and a shelter, we've got different policies. We've spent the last couple months aligning those policies. Both at the City of Reno and county staff have looked at that. And I think today we're about ready to publish a document that applies to the campus, and you'll see a little bit more consistency there. Then we're looking at things like grievances. How are they handled at Safe Camp? That's a lot further along than the shelter because we've spent time working through that. Now we're gonna duplicate that same thing over at the shelter. So yes, a lot of safety concerns. We're addressing them in multiple different ways.
Thank you, Dana. And my understanding is that you're addressing a lot of elements of John's presentation in your next presentation. So I really want to make sure that we hear about that progress and really dive into the specifics. Do I have any more board questions or Anything else for John? John, thank you so much. This is a frank discussion. I'm so glad we're having it, and we really appreciate having you on the team so we can really solve homelessness in our community.
Honored to be here. Thank you so much for the opportunity.
Thank you. Okay, next up, we're going to get a board update and discussion on the Nevada Cares Campus Homeless Service Campus Operations and Capital Project with Dana Searcy.
Okay, so as I mentioned, Dana Searcy, Washoe County, I have a lot of partners with me in the room that I may call up to help answer all of your questions. I'm gonna take you briefly through quite a few developing or new tidbits of information for both the Safe Camp and the emergency shelter. And then we'll get to your questions and we'll let you kind of guide where you'd like to dig in deeper and have some more discussion. So we'll start with Safe Camp. Just some stats, and these are changing every day, but there are currently 45 tents in the Safe Camp. We keep them as full as possible as soon as somebody is moved out into housing or has moved out because they've determined that's not the best place for them. Then we are filling that back in with our committee that evaluates all of those applications. There have been 64 participants served with 21 exits, 13 of those to stable housing. 8 more are currently scheduled for move-outs. These are vouchers or on the list for housing placements. And I was just told by staff, we have 2 of those 8 that have been accepted into an apartment complex. So we're excited for these numbers to continue to go up. And our calls for emergency service remain fairly low. We're pretty proud of that. Also, the operator RFP is open. It will close on November 12th, and we're anticipating that contract to start with the new year. Winter plans. We appreciate that this has been a large discussion amongst many who are concerned or interested in how the Safe Camp is going. I would start with the reminder that the Safe Camp for this community was a pilot program. It was built with the intent that people would stay in their tents, have their privacy and their belongings with them, and that we would build alongside that camp a smaller but still large enough sprung building where everyone in the camp could sleep in the building, whether it is too hot or smoky, or as we all know, during winter when it is too cold. What we learned, as John mentioned, in August when all that smoke was here, was that it didn't matter how many times we talked to individuals, it didn't matter how bad it got, it didn't matter that we had capacity at CARES Campus and a place for them to get out of the elements. They did not want to leave their tent. And so at that point, we made the decision that a safe camp with tents was not going to be something that we could sustain for winter. So we started a process of evaluating all kinds of tents, every tent under the sun that you can imagine. Ice fishing tents, there's some of these that are in use in Denver. We've looked at what they've done. They've got heating elements under them and ice fishing tents, and it is still too cold. So that's the best option that we had, and they're fairly expensive. They're about $1,500 a piece, and it is a tent. It will still rip, that kind of thing. We looked at tents that are used out in for Burning Man. They are seal-proof, so if you zip them all up, you create a seal-tight shield, and air doesn't circulate through the tent. That would be a problem in our safe camp. So we came to the conclusion that we needed to look into these individual pods, and we wanted to make sure it was something that would have minimal maintenance, keep everybody warm, and still be efficient enough that we didn't have tremendous heating bills. So Mod Pods is the answer that we have landed on there. So we'll talk a little bit more about those in a minute. But until they get here, what we've been doing is working through how do we keep everybody as safe as possible. I would argue that, and I think all of our staff would, that they are much safer than they would be if they were unsheltered. First and foremost, the CARES Campus is available to them. When the temperature dips below 50 degrees, we talk to participants multiple times a day. offer transportation over to the CARES campus. That is the campus shelter. That means that they'd have to abide by all of those rules. They cannot take all of their belongings, but we have a place that we can lock them up and keep them safe. But if they want to get out of the cold and warm up or take a bed at CARES, that is available to them. We also have our participant advisory board, which is part of our grievance process. That board meets every single week. And I'll let Grant and Austin, our staff, come up and speak more to grievance process in a little while. But that board, that is all members of the Safe Camp. And I believe, correct me if I am wrong, but attendance of the 45 tents is usually about 20 or so of those individuals come each week to talk about what they like, what they don't like, what they need, and how things are going. So we take all that feedback and we use that to make sure that things are successful. We have addressed drainage concerns. This Safe Camp was not developed as a long-term. It was a temporary site to get it open as soon as we could. Tents are on the ground. So we've, we're doing what we can to dig little drainage and that kind of thing. They're on gravel, they're on asphalt, that kind of thing to keep them out of the mud. Everybody's on an elevated cot, so nobody's sleeping on the ground. We've addressed tent. We've found out that they don't hold up very well in the sun in Nevada. So we have quite a bit of literal shredding of tent material. So we are replacing tents. We've deployed tarps. Last weekend with the really, really wet weather, the tarps have come out. Sweatshirts, gloves, socks, hats, that kind of thing, that's all provided at the camp. Wool blankets and sleeping bags are also provided at the camp. I would assume, we haven't really talked about this very much, but a lot of stuff probably got wet last week. If you're sleeping in a tent, there's not that much that we can do to keep the water off. But Grant staff runs everybody down to the laundry, and we've also got laundry at CARES to get stuff dried off, and we've got a backup of blankets and that kind of thing. And then also hot water and coffee is provided throughout the day at the camp. This is the Mod Pods. We provided you each the flyer with more information about these units. We've looked at several. This one has quite a bit more insulation than the other units. The typical is maybe they'll heat up to 15 or 20 degrees above what the outside temperature is. We decided that probably was not enough to keep people out of needing additional shelter. So these are going to be brought in. They're $13,725 a piece. They are due to arrive in late November. We continue to check in. We continue to poke them that LA and other communities that have put in orders don't have snow, so we should we should jump the line, but they are doing everything they can to get those here as fast as possible. Once they get here, it's about an hour of setup, and we are working with the National Guard to see if we can get some support to have that ready to deploy as quickly as possible. On the back end, we're laying out some temporary electricity that will be going in the next couple weeks so that this is ready to go. Each unit is 8 by 8 by 8 feet. There is enough. That picture on the top right is the inside of an 8 by 8 unit. There's enough room for 2 beds, but each one will only have 1. They are heated and cooled. We're ordering 50 for our Safe Camp, and we've ordered an additional for isolation at CARES. We got into a little bit of a crunch with some of the COVID housing and that kind of thing, and we toured with Pat and his team in Sacramento, some of the other VOA campuses in Sacramento, and they had developed a couple of these little kind of isolation sites, and I think we're going to try it and we're going to see if it can work. Safe Camp construction. So this has, I would say our budget has stayed the same, but our construction has evolved quite a bit. An opportunity developed to fill the bowl. Not all the way, but this is kind of where is the diminishing returns here. So we didn't want to wait a year and a half to fill the full bowl, but if we would have waited just a few months, we were going to be able to fill the bowl. It'll be within 10 feet of the top. It was about 35 feet to the bottom, It's a lot of dirt coming in. And so it has delayed construction, like I said, about 2 months. So it will start in January. But essentially what that has done has given us another acre of land on the CARES campus. It's an enormous amount when you're considering how do we find little acres here and there to build permanent supportive housing or other, programs that our participants can transfer into. So there are no plans yet for this extra acre on this map, but this is how it's been redeveloped. We've kept the safe camp on the east side, so it's closest to the shelter, and we'll share some of those resources like laundry and that kind of thing. All of the green is grass. Each of those little tents, the little X boxes are tents. We're sticking to our 50 right now. The blue, it's hard to see on these screens, but the blue is a large shade structure with some picnic tables and that kind of thing. And the orange, the bigger building, is a small sprung where meals will be served and training and case management will happen. And we're evaluating whether it should be a sprung or a metal building. I understand that cost-wise they are about the same. And then next to that, the second smaller is bathrooms. And now the emergency shelter. So much of your staff from the county and the city of Reno have been very busy with this transition. And I like to describe it as muddy because right now every single question that comes up, we kind of have to figure out whose ball is that in, whose court is that ball in and where is that contract. So we do currently have contracts at the city of Reno with VOA and at the county. And what we're doing is we're working through this comprehensive process of moving everything over to the county. And when it comes to the county, we're ensuring that the proper procurement has been established. Because we moved so quickly and we had to get everything stood up and we were under a state of emergency, a lot of things were able to move really fast. And now we're taking the time to make sure that once it's reestablished at the county on a longer term contract that everything is in place and again, properly procured, given all of the different funding sources coming in this year. We've also secured the campus. So to John DeCarmine's points and all of your points, we have made a lot of progress based on some of those recommendations. So there is a gate. It is closed. We are monitoring who is coming on campus at all sites. We track all emergency vehicles. We track anyone there who is staying there. And we also track anyone who is there who has who's using daytime services, whether it's just there to take a shower or needing meals all the time. We are tracking that information. So if we are not in an inclement weather situation, the campus is open from 6 a.m. to 6 p.m. If they are on site by 6 p.m., they can stay as long as they'd like to finish a meal or a shower, whatever they are there to do. If we do get cold or hot in the summertime, then we are expanding that. So right now, if we hit 35 degrees overnight, or less, then the campus will be open 24 hours a day, and we will keep that day use area room open for warming. And you'll see up here, the warming area capacity is 112, and our bed capacity is 604. So that has been updated. We've been working closely with City of Reno fire marshals, and also building departments been brought in also. So continuing to develop, but that's the numbers that we are using right now. Training, sorry, we skipped one, women to our place. So we've made a shift. It's not a harsh shift. It's not a line in the sand. What we're asking is that women, instead of the first place they've been brought to has been CARES campus. And really that's because it's down in kind of the heart of what's all going on, and our place is full a lot of the time. We have shifted that to say, you gotta start at our place. You gotta call, you gotta see if there's a bed, you gotta see if that's an appropriate fit. Because the more women that are in CARES campus, the fewer beds that we have for men. And the more appropriate place for women is at our place. Amber has been wonderful, and so has her staff. They've been doing a lot to get us information about what beds are available each morning, what type of bed, who can come and who can't, offering transportation when they can. So we've been working to reduce those numbers. This has been in effect about 3, maybe 4 weeks now. If our place is full, or if someone cannot go to our place, then they are welcome to be at CARES Campus. If they were already staying at CARES Campus, then we're offering them to go to our place, but we're not requiring it. At a high, we had about 85, 86 women at the CARES Campus. Right before the weather turned cold, we got down to 58, so it was working. We've creeped back up to about 70, but we'll continue to see how we can transfer women over to our place. John DeCarmine came once in May, is when he was first here looking at the campus. He came back in September and spent 3 days with us and all staff at the CARES Campus, Karma Box, VOA, the Washoe County staff, and also Allied Security were invited to participate in a 4-hour training with him, all on de-escalation and housing focused and some basic skills to help kind of start to build this foundation. Those were recorded and will be shared with our COC and will also be used as a training tool for all staff that come on board at the campus. Obviously, training doesn't start there, but it was a really big step forward, and it was wonderful to see everybody get in a room, which doesn't happen very often with the staff spread out so much over 24 hours a day. And then the staffing. So as I mentioned, we are working on hiring staff positions that are already approved in our budget and also reviewing needs and appropriate ratios for staff moving forward. I mentioned the updated capacity. Overflow is on here. We are monitoring capacity extremely closely. No one at this point has waited more than 4 hours for a bed, even in the worst weather that we have seen so far this year. That doesn't mean that it'll be enough for winter. We were just talking the other day and figured out that in the last year and a half between our place and CARES, we've tripled capacity for the emergency shelter, and it probably still isn't enough. And I know we're in this balance between, we need to focus on getting people actually housed and building permanent supportive housing and kind of finding that exit and making sure that people at the campus are appropriate to be at the campus. And if we're doing that, then that should relieve some of these capacity issues. But that really takes a lot of time and it takes appropriate staffing. And so we're in the middle of emergency. It's winter, it's snowing. We don't have a lot of options. So we are looking at overflow. The best ideas that we have for the campus is a partnership with Reno Housing Authority that we're working through right now. One of the buildings specifically on that campus is the really long, skinny garage. It is insulated and heated and could be ready to go with a couple days prep time. So we're working through the possibility of that. A backup plan would probably be a tent on the campus. What we have established is that with such limited staff and all of the services that have just been relocated over to the CARES campus, it makes sense to keep all the overflow options at the CARES campus. It allows us to best spread that staff out, take care of everybody who needs support, and make sure that all the services are still provided. Also, our website dashboard. We, as of Thursday, have a full dashboard on our website, which will have a daily count. I know everybody's been patient with us as we've been developing that, so I really appreciate that. It includes CARES Campus Emergency Shelter. It includes the Safe Camp, even though that number right now is always full. We anticipate that one day maybe it won't be. It also includes our place. The caution here, as I have promised staff I would say, that's published once a day. Bed counts are taken in the early morning hours, usually around 2 or 3 in the morning when beds are full. That changes quickly. A lot of people come in 5, 6 o'clock in the morning when we see our coldest hours. So 1, please call ahead if you're looking for capacity to all of our partners. And 2, 1, it changes quickly, and 2, it isn't always an appropriate match. So for example, if it's a top bunk and we're looking for somebody that needs a bottom bunk, we may have to move some people around or see if we can make it work before we can accept someone. But there is a daily posted count. And that's on washowcounty.gov/ /homelessness. That's our main homeless page. This is a snapshot of what it looks like. It's completely interactive. It has a history back to when we opened each of these programs. You can click on a day, it'll tell you men, women, pets, dogs, cats, all that kind of thing. So you can kind of watch and see as this changes over time. The main page just has a quick snapshot at open beds in each of the different programs. And CARES Campus construction. So this is a big one. We do not have a new design. I hope to be able to bring that back to you in December. We are kind of teetering two sides here also. We've got the emergency needs, the winterization. The showers are not faring as well as all of us had hoped that they would. So we're bringing in some support to make sure that those showers last 6 months. There is some mold and some, the walls are kind of peeling off and that kind of thing. I think it's just a lot more water than those units were designed to hold. And so we're working through how can we increase ventilation and seal floors and that kind of thing to make sure that is a viable option for everybody through the spring. And then we've got the overflow also, closely monitoring capacity, making sure that we have enough space or overflow for anyone that should need shelter this winter. And then design change. So we've learned a lot about our sprung building in the last month, I would say. The way that the sprung was built means that we cannot cut into the concrete slab. The slab that's there needs to stay there. And that means essentially that we cannot put our kitchen in the middle of the sprung because they would have to pick a lot of that concrete out to put all the plumbing in. So we're going through a redesign right now. What we decided to do was put a couple of things in the sprung that don't need to touch the floor at all, like the storage of belongings and that kind of thing. We're increasing capacity a little bit, just kind of expanding what we already had, those individual little cubbies, so we'll see a little bit more of that. And then we're re-looking at the rest of the layout and how do we incorporate the kitchen and the dining room area that is needed into that design. The other thing that I think became a lot more aware to everyone was that as much as we really want to enclose this front piece where we don't have a lot of emergency vehicles driving through there, we can't put enough doors on the back to allow emergency access that we need. So a little bit of a redesign. They're all boxes that are developed and we're just gonna move them around and bring it back to you. So a lot of progress, honestly, but it is a change and we're adjusting appropriately. The shower rooms, which is bathrooms, showers, and laundry, the two little pods, there'll be two on either end of the sprung. Those are moving forward as planned, and construction right now is slated to start in March. So that's why we're trying to get our bathroom and shower units to make it till March. And with that, I'll stop and let you guys ask questions. Let us know where you want to go.
Thank you very much. I have a few items. I'm just hoping you can help clarify or clear up and help us understand how we can support you. As you know, Dana and the county staff know, I am like pushing staffing. I wanted additional staffing, and hearing John's presentation, I'm sure that the rest of the board feels like we really need to get our arms around that, especially with the safety concerns that were brought up. I understand that you're filling positions that are unfilled, and I just would like an idea of how do we move forward with the next phase of staffing to ensure that we've got enough monitoring going on and support, and then also the flexibility with staff to help with the case studies or the case management, of the people in our care.
Sure. So we are targeting staffing in 4 different areas. The first one is obviously case management. We need to make sure that we have appropriate levels of case management, and as John mentioned, that is about double of what we currently have. The other thing I would just preface this with, we're building this all on ratios because Obviously, our goal is to not have a 600-person shelter
Sure,
forever.
right.
So as we make improvements and as we move people into permanent supportive housing, then those positions will not be refilled, and we will maintain appropriate staffing ratios. So if we say we're gonna get to that 1 to 30 for case managers, that's great. That doesn't mean that we will always have 20 case managers in the building. The second one is diversion. So when the campus is so short-staffed and there are so many people there, when you show up and you say, I need help, you're brought in. And having a full diversion program, as John is alluding to, is nowhere near capable with what we have. So just some basic, fresh eyes on how do we implement a diversion program, which we currently do not have. Then we're gonna look at some nursing staff. A little bit probably contracted is gonna be the recommendation, because this is our attempt to try to reduce the number of 911 calls. We're working very closely with REMSA to monitor what all of that looks like. They are still on site an average of 7 to 8 times a day. It's a lot. When they're there, they're grabbed by 4 or 5 more people on their way out the door. So I think just having some basic triage. Do you need a Band-Aid? Do you need just somebody to listen to you? Or is this a true emergency that we need to get you the help that you need? That'll be part of this also. And then, like we all know, the mental health support. Our place has 2 mental health counselors on board. Amber has talked to me about how important that is, and that they're seeing some good outcomes there. This would not be intended to provide mental health support or long-term therapy for somebody. This would be intended to keep the campus safe, to be able to help somebody who's in a crisis and identify an appropriate place where people can go, or help with some medication so that we can get them a little more stable, and then again, get them to where they should go.
Conflict resolution,
A lot of that,
so
yes.
that we don't have the
yes.
sheriff's office going down there.
Exactly. So, I hear sheriff is telling me I need more sheriffs because we need to respond more often. And I say, well, no, actually,
Right.
we need to do a better job so you don't have to come more often.
Right.
So, yes, we are working through that. And then another piece of this is honestly, where do those staff belong? And, now we've got 2 operators on site, one at CARES Campus Emergency Shelter, one at the Safe Camp. We've got county staff on site. We've got allied security on site. A nurse contract possibly, or medical aid, that kind of thing. So we're really sorting through which staff should belong to which organization, and what level of staff should each of these be.
What's the timing?
I have a draft ready to go.
Okay.
So we will, happy to sit with you and Commissioner Lucy and Eric,
Okay.
and we can work through where we want to go from here, and what we, the other thing we're trying to build in is, here's kind of the emergency needs, like here's a baby step we could take immediately, and here's where we want to get to ultimately, so that if we are not all comfortable putting that many new staff at one time forward, then we have some steps we can take.
Well, I think, I'm sure this board would love to see an update on that in December, so maybe that's the goal that we strive for. So we sit down this month and talk that through and see where we're going next. I also know that our housing specialist is working on a rental assistance program, and I know it's not released yet or about to be released, but that should be helping with some of the diversionary issues that you're seeing. And I would love if you could touch on some of those efforts, just so people understand that we understand that we want to get people in housing first, not emergency shelter first.
Yes, so that's the EAEAR2 funding. A lot of us received the emergency housing rental assistance. The first block, a lot of that went to Reno Housing Authority. The second block that everybody got, and I believe that Reno is doing something similar, but I don't have the details on it. We are funding 2 housing navigator positions out of that to help take that second block of emergency rental assistance to get people housed. We've got a lot of just, let's help pay your bills, let's help keep you housed. This is really focused on, let's identify who has a little bit of income, who's ready for housing, and then we will get them there. And then that housing navigator will continue to touch base to make sure that those individuals remain successful and remain housed.
Wonderful. And then the redesign with John's recommendations, are we taking those into account of having more of a smaller area for our case managers and those who we contract with at VOA to manage the spacing?
You know, yes. One piece of this is the little cubbies, similar to the Our Place style that we've seen work
Sure.
really well over there. About 180 of the units will become those. And then the rest of it, I think that's a good comment from him. I had not heard that one yet in his recommendations, but I think what we also saw in our Sacramento tour was floor-to-ceiling dividers that were pretty much the same fabric as the sprung, and it was pretty effective to divide space. Right now, the staff is so thin that we could not do that.
Sure.
But yes.
Okay, great. Well, I will go now to the board. Yes, Councilwoman Jordan.
Thank you very much, and I know we're running a little bit low on time. I did want to say, I just pulled up your dashboard. It looks great. I think that will help with some of the communication issues. I know there are a tremendous amount of people that understand the severity of the issue, understand the emergency nature of these issues, and are just seeking communication and information. And waiting in between these meetings is difficult. Information is king, and sharing that information is very, very important. So beyond the numbers, which it looks like that's all the data is in here, will this website be used as well for, ticker updates? We've heard some comments today about the tents and during the flooding and that sort of thing. Will we have an opportunity to put live, real-time updates so that information reaches those who are in daily contact with our houseless neighbors, maybe even outside of the campus, so that they have current, up-to-date daily information? Because I know staff and everybody has been working feverishly behind the scenes to address all of the issues, but I don't think a lot of information about the updates is getting out to the community as quickly as maybe would. It's just questions being answered. I think there needs to be questions answered. With regards to the staffing, so security, case management, diversion, and nursing, how many additional people did you anticipate?
So I honestly do not have that ready to go today, but case managers, we need to get honestly to a 1-to-30 ratio. That would be 11 additional case managers. I think our frontline staff is okay. When you look at the positions that aren't filled, we do have that built into the budget already. We need to implement diversion. That's 24 hours a day, needing to have someone there who, when you approach the campus and say, I need a place to stay, we can help you work through all the different options so that we can try to keep you out of the campus and still find you a safe, better place to be. Mental health support, that would have to be also built from the ground up. We're trying to figure out how we can maybe stagger some shifts and not have 24-hour-a-day coverage on that, but just really having a person that you can connect with, and some people there that are truly trained therapists to help train other staff. We think that can make a pretty big impact also. And then nursing support, again, 1 or 2 on site 24 hours a day.
So do you know when, particularly the security and the case management, additional personnel, when you'll be putting out for those hiring?
So we do not currently have additional security in the plan. There's currently 4 on site, 1 at Safe Camp and 3 at the CARES building and gate. So that should remain constant.
So, but you believe the additional case managers will help with some of the things identified earlier as security?
Yes.
Because of just the simple numbers, the overwhelming numbers? Okay.
Absolutely. And part of this is also by bringing staff to the front gate, we can help work through a lot of these troubles before, right now you have to kind of get through security instead of being welcomed in, and then, security comes secondary.
Okay, and then, and I know others have questions, and I know Northern Nevada Hopes just secured the property, and that will be phenomenal when they, for a lot of the mental health issues. The building on the property, the Wells Cargo building that is heated and insulated and available, Do you know when you will be opening that and to which population? Or are you moving the women there? Are you moving the food service there? I'm just trying to understand the timing and the who.
Sure. All to be figured out. I am working with Amy right now over at Reno Housing Authority to figure out what that looks like and how fast we can make it happen. Wells Cargo has their lease through December 11th, so nothing can happen before then. And then that's, I think, our fastest option right now is to have a lease in place, ready to go, and plans in place that we can deploy. The intent would be the same population that we're serving now. So he's over to our place unless they're full or you can't be there, then you'd be welcome. We have not talked through separating the women out. I think that the more we've worked through this, the couples, the women, you know, I'm a couple today, I'm not a couple tomorrow. We got people kind of changing beds and all of that. It has just been too much right now with limited staff. So we'll look at it. I think that's a fair comment, that it's a good opportunity to see if we can split out some women from the main tent. And then food service will remain where it is inside the CARES building.
Okay, and then the final question I have is between now and December the 11th,
Yes.
with regards to the overflow, what is the plan between now and December the 11th?
So most important would be permission from both our board and the Reno Housing Authority to put a lease into place.
But that's not till December 11th, so what's happening between now and December 11th?
No, I think right now is the conversations to get that moving and to work out all the details of that. And then on the other side, our facility side, we're, as I mentioned, we're working with National Guard. So they've reached out, they're willing to help. So this is one of the major projects that we're giving them, the Mod Pods for the Safe Camp and the shower retrofit, all of those three things. They're gonna bring out help and get us plans in place and all of those.
But there's still about a 45-day gap.
There is.
And I've not heard an answer as what's happening in the next 45 days.
To the people, our overflow folks who.
So currently, we still have capacity. Right now, there's 7 beds open at our place. There's 21 beds open at CARES Campus. People are welcome to come into CARES and sit and wait for a bed in the event that it is full. And as I mentioned earlier, no one has waited more than 4 hours right now for a bed. People will not be turned away. We will be working through it. And the backup plan would be probably a pop-up tent on that area. I think one of the things that is a possibility, the shade structure that is there, all of the tent sides are there also. So that's a possibility that we have in addition.
So you don't believe between now and December the 11th that capacity issues will be an issue?
Well, I cannot predict. I don't. We're watching it really close. We're not there yet.
Okay, and again, your dashboard, and I just barely clicked on it, it does look phenomenal, and what a great opportunity to push information out in real time. So thank you very much.
Thank you very much. Do you have anything, Mr. Mayor? Do you have anything, Mr. Chairman? Yes.
Thank you, Madam Chair. Ms. Searcy, thank you for the update. This has been phenomenal, and I know how hard you've been working on it with your team, so I want to first thank you for that. Talk to me, and I think a good portion of the board has already kind of covered the issues of the security and the staffing issues, and I think you've answered those fairly well, and I feel comfortable with that. But I want to talk about the recidivism rate. As we're talking about Safe Camp and those that we're placing into housing, are we seeing a recidivism rate, or are we tracking that in Safe Camp right now?
Sure. Thank you for the question. Yes, we are tracking. We're a little too new to be watching for a recidivism rate right now. We have opened since we opened on June 17th. Usually recidivism is tracked over the course of a year, but we have implemented heavy data tracking and all of that within the Safe Camp, and we will be able to give you that.
And you will, for those that we've been placed into housing?
Yes.
That have left housing and are coming back?
Yes,
Okay.
and I can look back over my shoulder here. Do you guys?
I'm looking for, I got a nod from Mr. Denton in the back as well, so I'm seeing, yes, okay, that's great. You know, and I want to stay focused. I think it's important that we have this discussion, is that the need for the Safe Camp and the CARES campus has always been that emergent need, right? This is the emergent need for individuals without housing to find them a shelter through all the elements, whether hot or cold, to make sure that they're safe and taken care of. This is not a permanency. I think things that we talk, Mr. Carmine brought up is that how do we have safe, controlled entry and exits? And I think one thing that your team has been working on, and I'd like to continue through Mr. Carmine and through all of our staffs, is that we focus on, because this is a low barrier shelter, and we don't have a specific adult population, it's difficult to say when you can come and when you can leave, right? Everybody can come, and we're never, until we can find housing and whatnot, we can't tell you to leave, which is very much different than our place that's a specific population that has some guidelines. However, we need to have some preventative rules and some security and some understanding about how we move individuals through the system. And I think what you've heard today from the other members of this board is that that is going to happen through staffing and casework functionally. And people may feel that I'm a critic of this, and this is not the case whatsoever. I think that this is a necessary need. However, in your presentation, you look at the Mod Pod at almost 14,000 because it's 13,000 specifically for a unit, but then by the time you install it and cost, they're about 14,000 bucks. 52 of those units, that's roughly 750,000. And I'll tell you what, I'd live there. I'd live in this. There's no problem with this. This is amazing. And we have a number of these across the street. We have a number of these with, and so as I see what we're trying to accomplish from safety standpoint for these individuals and securing them from the elements, this does not look emergent. This looks more permanent to me. And so I have some concerns with this, and I'm just going to put that out there now, and especially at the cost. However, I want to make sure that we're functionally looking at this at all levels. And so are we really trying to do emergent? Are we trying to do housing? What are we trying to accomplish with the Safe Camp? And what are we trying to do with housing? So there has to be that differentiation. But those are my comments, and I absolutely agree with the security and on-site amenities necessary, which are highly related to medical and security. Because not having individuals there to address the needs and having the RPD, REMSA, Washoe County Sheriff, SPD respond to these all the time is not at the best interest of anyone in the community. It is a absolute a detriment to everybody's not only budgetary but time, and we're not addressing the issue. So I'd like to work towards that type of training about making sure that those needs, and I know you are, but to Councilwoman Jardin's point, that level of understanding and outreach to the community through the dashboard and still trying to train in that direction, that's the things that I want to look at, because that's what makes our place successful, and I want to make sure CARES Campus and Safe Camp are successful in the same sense that we're moving in the same directions, but we have to go kind of two different paths because of the populations within those, and we have to have a different ideology because one's emergent and low barrier and the other one's not. And so those are the kinds of conversations I hope this board and all of them are having to have those discussions in regards to emergent shelter. So thank you, Madam Chair.
Thank you, Mr. Chairman. And I think Councilman Reese has a comment or question.
Yes, thank you, Madam Chair. I want to first say thank you to Ms. Searcy and your team for all the work that you're putting in. It is difficult on a daily basis to kind of keep up with the number of questions that we have, and also, fundamentally trying to do the right thing by folks who are experiencing being without shelter. I want to ask very specifically about really three things. One is a motel voucher program, something that the county has done in the past at certain times. I want to understand the limitations of it, or maybe the efficacy of it. I mean, why can't we use a program like that even on a short-term temporary basis. You know, Councilmember Jordan points out that whatever solution we might be seeing on the horizon is still out to December. At least that's what I understood the answer to be in terms of tenting or mod pods showing up or buildings at Wells Cargo being available for use. So the first question I have is motel voucher program. And a related question, and I'll see if they can be answered together or how you'll take them separately, which is really the question about the Record Street facility, the former CAC, why it cannot be stood up quickly. For my part, I think both are options that are worth exploring. I think that if it's a question of finances, we can have that conversation. If it's a question of political will, we can have that conversation. But both of those seem like, you know, relatively good opportunities for us to address sort of immediate sheltering needs. Obviously, we also exist in a town where you know, functionally we have a lot of motel or hotel rooms. I don't know what the experience has been with those kind of programs. So two questions really related there: motel voucher program, and then the use of the Record Street facility, if any. And then I have a third question, but I thought maybe if I pause here, it might allow Ms. Searcy to answer those.
Sure, and Member Reese, forgive me, I'd like to just make one comment on the Safe Camp to Commissioner Lucy's comments. I would say that I was one of the most cautious when we were asked to open a Safe Camp in this community.
Mm-hmm.
Many of us on our staff were extremely concerned and wanted to make sure that we were doing things with the right end in mind. What I can tell you, while I don't have a recidivism rate, but I would almost guarantee that all of the almost 15 people that have been housed are still housed. And I would argue that the Safe Camp is an absolutely critical piece to our structure that is extremely temporary. People stay shorter amounts of time there. And it's for people who will not go into a shelter. They won't. And it serves those couple people that we can take off the street, help them get stable, and help them find a place where they can be. And that is a tool that we have not had. It is the absolute opposite of what we are seeing at Hope Springs. And not out of outcomes or anything like that. That is a very high barrier treatment plan. This is a very low barrier. Come in and we will help you get stable and get housed. So we are maintaining that is a low barrier shelter. Those mod pods are $13,000. The individual cubbies, like at our place, those have just priced out at $8,000 a piece. So it is really costly to do this. And those individual units for people are definitely the best practice and where our nation is going. So thank you for just that one moment. Motel voucher program. One, it is very difficult to put someone in a motel that you are not sure whether that is a safe option for them or not. We do not have case managers to check up on individuals in motels. So that has been one really cautious piece of those programs. I did not work last year on that program when it happened. I have heard from our Director of Human Services, Amber, that she does not want to use that in the future due to many lessons that they learned. And they also found that most people did not choose to move into shelter once a bed opened up in shelter. So I would pause with that answer just because I don't have a lot of direct experience, but we at the county have decided that we will not use motel vouchers as emergency overflow shelter for many, many reasons. And the biggest one is safety. I would also share that Record Street, the idea has not been eliminated in any way, and it doesn't have anything to do with money or anything. It's really about logistics. One, the staffing. It is such a delicate balance right now to keep enough staff in that building that we need to make sure that overflow is as close to the CARES campus as possible. Two, that also brings some efficiencies with sharing the resources that are there, the meals and the laundry and all that kind of thing. And then the third thing is also, we just worked so hard to get everybody out of downtown and in a centralized place where they can, be together and start to develop this campus. By opening up the Record Street facility, we will now have 3 campuses, and people choose where they'd like to be. So I think that we would see a lot of individuals say, I want to go back downtown, I want to be back at Record Street. And that is not a situation that we can really navigate with the limited staff and all of that.
Okay, and I think I'm not sure I fully understand all the answer, but I think I understand enough to have an opinion. Let me ask about how we can include more folks with lived experiences in the decision making. You've heard advocates routinely say that we should have a lived experience board or have them on this body. I don't believe that they could be on this body legally, but what are we doing to include folks with lived experience beyond the fact that some of your key people, both as providers and as operators of some of these programs, have lived experience? What can we do to ensure that folks who are most impacted are having their voice known, their opinions shared, their experience offered? It just seems like we could be doing more in that area than we are currently doing. So I'd like to understand what opportunities there are for that, whether it's a town hall style forum or, and I don't mean by town hall coming to city hall or the county facilities. I mean, having discussions with members impacted most makes some sense to me.
Yeah, so first, globally, as you mentioned, many of the service providers in Reno, we are fortunate enough to have so many give back who have direct lived experience. Karma Box and almost all of his staff are people with lived experience, and we're seeing that across our other providers as well. Also, it is important to us to incorporate this into Built for Zero. It's important to Built for Zero. They require that we have feedback from those with lived experience in our meetings. Also, John DeCarmine, he has worked with us a lot to gather some feedback. It's very different if I walk into Safe Camp and ask someone how they're doing versus him walking in when nobody knows who he is and asking how it's going. So that was a critical component that we were proud to have as part of this report that he's been working on over the last several months. In addition to that, when we developed Safe Camp, we wanted to make sure that there was a very strong grievance process in place. So it's on 3 different levels. First, there is an anonymous tip box, suggestion box that is posted. Anybody at any time can put something in that box if there is something that they want to be heard or a concern or anything that they'd like to work through with staff. Completely anonymous, again, posted 24 hours a day. That's the first level. The second level are those weekly meetings. And I can bring up Grant and our staff if you guys want to talk more about this, but I know we're short on time. Those meetings have been absolutely key. To have a group meeting where we are sitting with participants, if we're invited to come, and talk through what's going on, what's working well, what isn't, to be able to pivot quickly and address those concerns is absolutely critical. And then third, there is a formal grievance process. If you are denied access to the Safe Camp, if you're removed from the Safe Camp, if you'd like to, formally have a grievance, there is in policy, which is posted on our website, there is a formal process that does, is not the same staff that you would just report, I'm cold or I want a blanket or something like that. So that is all in place. We're gonna take those same 3 steps and move them over to CARES Campus. They've had some grievance processes in place. We're gonna formalize it a little more. We're gonna do an advisory committee. Pat, you could probably speak better to that than I, but it's working well. The feedback is there. We look to include that in everything that we're doing. We're hearing it from you guys. We're hearing feedback in this public forum. I personally am talking to advocates multiple times a week taking meetings as requested, happy to share information. A lot of things that aren't ready to be, published in a nice, pretty presentation are not things that we can't discuss and talk through ideas and all of that, and we are doing that.
Councilmember Reese, do you have any other questions?
Yeah, I think I would just say, because Ms. Searcy, you mentioned an important component, which was about, it's not so much grievance related, but it's the request for items, right? One of the public commenters, and I do observe some of the comments that are on social media, spoke very specifically about the need for blankets, gloves, hats, hand warmers. Sometimes it's requests for batteries or food. I mean, I think all of those things are real and the requests are there. I don't know how we address those things. I don't know if it's because materials are leaving the facility or disappearing, or I just want to make sure that the needs that are being identified by community members, both the advocates and the members themselves, are being addressed. So, you're mentioning a very specific thing about resources. How are those resources being offered to folks? You, for example, you mentioned something like they can go online and look at a thing. Well, I'm not sure how many of them have phones. I don't know how they would get online. I think some do and some do not. So again, trying to figure out how to communicate with folks most effectively is really what I'm concerned about, and also identify the ways which they can obtain the items that they need.
So I've invited up Karma Box Executive Director, Grant Denton, to help provide a lot more detail than I can.
Grant Denton for the record. So as far as items we need, our staff has the ideal, our staffing is ideal for exactly what John DeCarmine talked about. We have 1/22 ratio. So we're constantly engaging, and that's not including the case manager. Over the weekend of the flood, and so we'll look at that, like the engagement of that, or what happened there. Over the weekend of the flood, I had the opportunity to stay in a tent. We knew the flood was coming, and it wasn't a tent that would have otherwise been taken by somebody who was unsheltered. That person had left that morning, and so that weekend I stayed in the tent. That night, it flooded. Now what happened was, we have a system. Now keep in mind, these tents aren't ideal for being lived in that long. They're just not ideal. But what happened was, we have a system in place where whatever's inside the tent is you, whatever's outside is us. What we're allowed to put outside of our tent, and that's to prevent cluttering or hoarding or things like that. Whatever's allowed outside of the tent is a cooler, a bicycle, a chair, and a trash can. Now what happened is, when the rains came down, a lot of the flooding started going down the gutters, and as it should. But when people moved the coolers were set out there, unpredictably, it caused this backup of water, which started to flood some of the tents that were further down. And so what we did was we cleared that morning. I got into the flood waters with about 6 participants. We cleared that out, and it still wasn't working. So we had to go down to where Q&D and Ames Construction built that little ramp, and we dug out little trenches. So that speaks to what happened in the flood. Now, did it cause blankets to be flooded? Absolutely. Blankets got wet, shoes were left outside, things were wet. Some folks had tarps on there, some didn't. So what we did was we bagged up all the clothes that were wet, and I had one of my staff take them down to a dryer and dry any towels, clothes, shoes, anything that was wet at the laundromat. In addition to that, we went and got over 45 blankets. We got more socks, we got beanie caps, we got gloves, and we got tarps and clips. So part of the gig is because of the zippers, they don't last long. That's it. You zip them up and you zip them down. You got about 2 weeks of high volume use, and it's just a wrap, dude. So we got tarps and draped them out in front. And in addition to that, we had 20 new tents come in. So when the rain, because you're not gonna change the tents when it's raining. So when the rain came down, my staff was activated and helped everybody change tents that wanted to change tents. Sometimes we can't force people to change their tents. And I think a lot of that is there's a lot of things. Sometimes they just don't want to take stuff out, and it's kind of got to do it on their terms. And so there's a dance that you have to do. So yeah. So anything they needed, they asked us for, and we got it.
Well, Mr. Denton, I appreciate the answer as it relates to those number of folks staying in the safe camp. I think my question is more broad. It's really a question about how do folks staying on the entirety of the CARES campus receive some of those basic needs. And I just fundamentally don't believe that our mutual aid groups and advocates should be having to hold bake sales and GoFundMes every week to provide some of those essential things. So I'm trying to figure out where is the role of our collective governments in providing some of those things. Again, some might say, well, we have a budget for this many blankets each month. The provider provides these blankets. I'm just saying when we meet a crisis or when a need arises, how can those things be provided to folks who are in need beyond, our community just coming together to provide them? I mean, Councilmember Jordan and I, for example, have done a Stuff a Bus event for the last couple of years for seniors. I think these happen with some frequency for other groups. Perhaps one of the things that we might coordinate fairly quickly is some kind of a Stuff a Bus program for folks. And I understand, because Mr. Denton, you and I have had this conversation before about what people accumulate when they are unsheltered. And I'm not trying to add to their burden. I'm just trying to make sure that when people have some basic needs like a sleeping bag, a coat, hand warmers, those kind of things, that we are finding a way forward that does not require us to have, non-governmental response be the only response.
Dana Searcy, for the record. We are working through evaluating a full program for volunteers and donations at the campus. It is still pretty new to the county, so understanding all of the needs is one of the things that is on the list. We've had multiple people reach out. Safe Camp provides blankets and sleeping bags and everything that Grant has just told you about. And that is at the cost of the program. That's not all through donation. Some of it comes from Karma Box donation work, but none of it has been from advocates or donations on site, because we have not been in a position to accept them yet. Pat could probably give you more information about the specifics of VOA, but we're providing 3 meals a day. We understand the blanket situation. We are going back out to RFP for all of the laundry and blankets at CARE, so that will be addressed soon. And then, as I said, the donations, and VOA has a donation process and a volunteer process. The county is working to understand that and understand how we expand that for the whole campus. And here is Pat to talk to you about specifics related to needs in the emergency shelter.
Thank you. Hi, for the record, Pat Cashel, Regional Director for Volunteers of America. VOA's always had an ongoing fundraising campaign. Specifically, we have Share the Warmth going on right now, which we do collect blankets, gloves, hats, everything we've been doing for years now. One of the issues that we have at the CARES campus is we think we get to a level of blankets and there's a process to up those levels because we have contracts with the providers. So it makes it difficult to up those levels overnight. And especially since our provider brings those blankets in from Sacramento. So we try and stay in those levels, but we seem that we haven't been able to pinpoint that. And a lot of that is due to multiple blankets given to clients and also theft of blankets as well. So, but I think that all comes, it's part of this process. I mean, the shelter is so big. It's something that that I'm not accustomed to running. There's a lot of issues and things that we're working out, and that's one of them is going to be the blankets. One of them is going to be a process of donations. I can say that we're all working in that direction. Have we figured all this out yet? Absolutely not. But VOA, we're constantly taking donations, still down at Record Street. So if anyone does want to donate to us, we're more than welcome to.
Thank you, Mr. Cashel. I think your point is well taken. And at the same time, I want to make sure that we don't let up, that we put the pedal to the gas and make sure that we are providing those things. As to Ms. Searcy's point about the RFPs that may be in the process of being developed, and I'm certainly interested, for example, not in micromanaging that process, but in knowing that as a component of, say, for example, the food contracts, that we can improve folks' access to nutritional, high caloric foods, fresh vegetables. I know that there are plans for, on-site gardening. I just think that we have some groups in town that are, who have some greater experience in providing those kind of nutritionally rich foods that we can make certain that in this RFP that is highlighted. So meaning to the extent that we'll have any role in developing those or having input into what goes into them, I want to make sure that as to food, for example, we're trying to find the best food quality that we can and improving what we know has been what can always be improved, right? I think your point too, Ms. Searcy, is well taken, that we're delivering 3 meals a day. I just want to make sure that we're delivering meals that, as Commissioner Lucy said, he would be willing to live in a mod pod. I want to make sure that we're delivering food that we would be willing to eat too, right? Just conceptually. And I think that's an important component of it, especially as it relates to access to fresh fruits and vegetables and that sort of thing. It's healthcare, right? Food is healthcare. So I want to make sure that that component is not overlooked as we seek to find the cheapest way to provide food services for a large number of people. And again, I'm not complaining about the efforts. I just want to make sure that we're improving.
Absolutely.
Thank you. Councilwoman Jordan?
Thank you very much. And just to that point, and being on the fundraising committee for the Phase 2 of the Nevada Cares campus, I will tell you that there is a huge contingent of very compassionate and giving people in the community that want to be a part of developing the campus and helping to contribute to it in the way that is most needed. Some people can write checks, right, that we can allocate in the most effective ways. Some people can knit. Some can, collect and provide socks. It's just that mechanism by which we can communicate with the community of what the need is and the most efficient way to bring it to the campus, whether it's the faith-based community, the advocacy community, and how do we do it in a safe and effective way. With regards to the food, I think the concern is we certainly don't want just the distribution of food, along the riverbanks or in areas that can't be maintained in a safe and way and distributed in a way that doesn't cause more problems than good. But how do you organize that on a campus to, let's say, an organization or a church or a group wants to serve a hot meal, every Thursday? That's coordinated through VOA in the campus, maybe, and it supports a small business so that it covers the health department's concerns of the food is not going to be unsafe. And they're also connecting and being empathetic with a community that would maybe like something different than the same thing, every meal, every day. And it engages the community to be empathetic. And my fear is that if we don't quickly and robustly come up with a volunteer giving sort of platform that works for everybody, with organization in mind, we may lose some of the empathy that the community really wants to give to this campus. They understand we have purchased the building, we have purchased the property. The campus is going to be the campus for emergency services, and we're trying to make it the best it can be. How can we engage the groups that want to give in an organized way so that Pat, with limited resources, et cetera, and I know it goes back to staffing, can help connect with folks who want to give and be a part of helping our most vulnerable. So I think there's a way we'll get there. I understand everybody's trying to eat this elephant a bite at a time and as quickly as possible, but I do think we need to engage the public as efficiently and quickly as we can.
Absolutely, and I think you're just leading us into our next agenda item, which I'm hoping that the board is ready to move on to, so we can at least get some clarity on that before we go to public comment and close the meeting. Thank you, Dana and Pat and Karma Box for giving us this background, and we'll be continuing to make improvements and investments. I appreciate it. Okay, next item is update, discussion, and possible direction regarding the Community Homelessness Advisory Board goals and objectives. To be included, permanent housing for the Nevada Cares campus and Our Place residents, community-wide housing resources and shared data, and engagement of appropriate community stakeholders. The vice chairman and I met, I think in October, to discuss what this, or maybe it was even September, to discuss what this agenda would look like. And we really wanted to put some goals down for the CHAB. I don't think we have a ton of time today because I think we're trying to close by noon for the meeting, but these were the three major things that I heard from staff as being concerns. How can we work on this, what John had talked about today, this affordable housing crisis, depending on your area, median income and what people are earning, and how can we get people into housing more quickly, and how can we work with ARPA funds to also get that permanent supportive housing, and then also that transitional housing that we know we have 300 transitional housing beds that are empty. Because we don't have the staff to get people in those. So learning some best practices, going back to that enterprise report that was done a few years ago with Truckee Meadows Regional Planning, and seeing how we can all implement those policies. That's something I know we're working on the county level to do. So that was one of the thoughts I had as a goal that we could get presentations on and also report out on. Another goal is this shared data. We still have nonprofits that are not working through HMIS, and I think we heard from a public commenter that we have nonprofits that aren't using it correctly. So figuring out how can we incentivize these folks to use this data so we all are on the same page on who's being served, how many people need help, and what we need to budget for the future. And then exactly what Councilwoman Jordan was saying is how do we engage appropriate community stakeholders and this volunteer program, and ensure that people feel part of the campus in all the ways that they want to give. So happy to hear any feedback, and I hate to rush the group, and we can continue this item certainly for December, but I'd like to hear from the board on anything specific.
I think, Madam Chair, I think you hit the few things that we need to talk about, but the coordination of the groups, volunteer groups, is a big deal. We've got plenty of people out there that want to volunteer. They want to cook meals. They want to give blankets. They want to be involved, and there's no way for us to do it at this point. I'm glad to hear Dana say that she's working on that volunteer coordination, because that's what needs to happen. You have to have somebody that, if I want to give a meal a week through my church, who do I talk to? And how do I do that, and to meet all of our health standards and whatnot that we need for the community. So that's a great program. I think that's the part that we absolutely got to have sooner rather than later. But the other parts of that, the housing infrastructure type of deal is we're in a unique position. You just heard John DeCarmine say that they have 19,000 available units in the Gainesville area, and we don't have 19,000. We're right now at a 98% occupancy rate in every apartment. Even the new ones that are being built, the brand new one at the Deco in downtown Sparks is already full. So our crisis is bigger than just a fewer apartments and whatnot, but it's going to be we're going to have to figure out a way to make it happen. There isn't that lower end. Those apartments that are on that lower end are being used by many of our seniors and already our low-income folks that live with us. So there's just not a glut of housing out there. We'll have to figure that out. That's definitely something that we're going to have to do as the cities in the county to figure out what we're going to do as a long-term program to incentivize folks to build some of those homes. But at this point, there's absolutely no reason for a developer to build low-income housing. The market is way too strong. We're running out of land to build on. So everything just getting more and more expensive. So it's a tough issue. But I think what we have in this advisory board, we actually have zero power. So I want you to know that we have zero power on this board to accomplish anything. But what we are is the gathering place, and that's what we've been for nearly 4 years, to bring everybody together so that we can find that community solution. And this whole campus would have never happened if we didn't have this community homeless advisory board. We were able to act. We knew what the problems were, and we knew what we had to do, and we were able to make that happen. It's amazing to me that it was less than a year ago that we first started talking about this. And we haven't even been open 6 months. Yeah, we got problems, absolutely. You're always gonna have new problems when you open a new business. So we're gonna get there. Be patient with us. We're gonna figure out a way to make this all work. The entire thought behind this entire campus was to go from being admitted to the emergency shelter to getting some mental health care, to finding some transitional housing, to finding permanent housing. The Built for Zero program, you got to take out as many as you put in. So we need to figure out what our level of homelessness is. Some communities know it. We don't know it right now. Our level of homelessness might be 200 people. And if we keep at 200 people, then we're good. But we're not putting anybody out on the other end at this point. So that's where our issue is at this point with the emergency shelter. I get it, you know, it's a warm and cool place to be, but we're not to the point where we're solving the problem yet. So that's my 2 cents worth.
Thank you, Mr. Vice Chairman. Mr. Mayor, yes, Councilwoman Jordan.
Thank you very much. I do think to that point, I think something we need to focus on as the permanent supportive housing is going to take some time to develop and augment for all the reasons as have been stated. I do think the thing that we have seen success with, that this board and this community was very progressive and proactive in implementing, were the things like the Village on Sage Street and the Tiny Homes Project. If you remember just a few years ago, those didn't exist. And we took some city land with some creative minds and some advocates, and those products are out and working and are full and are proving to be successful. So how do we duplicate those sorts of programs in other areas? As an example, we know at RTC, when there is a road built, there is often remnant parcels that are not always ideal for a larger project, but they might be opportunities for some of the Sage Street or Tiny Homes type projects, because they're normally ill-shapen, they're normally a little smaller, but most of the time they're near transit, which is a very good thing. And how do we as a board help to coordinate with the different governmental entities to identify the properties and what sort of product we could put in place for the transitional in the short term as the more robust housing, affordable housing starts to come online, which I believe it will. There's some money through the feds that is coming that I think will really help us with that. So I would like to explore how this board and our collective staffs can help to be the bird dogs to connect those dots, because I feel like that's what's missing, is somebody coordinating those, but to look to our past successes on things that we were very proactive in supporting, and I think have really helped. So I'd like to explore that more.
Thank you. Do you have anything, Mr. Chairman?
I think I've made quite a number of my comments earlier today, but I do, to Mayor Lawson's point, I think that this board has done a ton of work to provide a platform for individuals, not just advocates, but for staff, for community members to get involved and truly move the needle. And to his point, this is not somewhere where we can make, even though it says on our for possible action, this is not something where we make any decisions from a policy standpoint to dictate to any of the levels in regards to funding or capacity. You know, we want to make sure that we're working with the community, the municipalities, all of the volunteers within the community to truly make this an effective process. And we're 6 months in, and yeah, we have challenges, but I think what we've done is tremendous. I think the accomplishments that we have are tremendous, but I want to make sure that we stay focused and utilize a CHAB as a place for individuals to come, discuss what they feel or are seeing in the community. But we as a board should not be in the place of dictating to operators or anything like that. This should be policy driven. This should be policy driven about what we need to do, how we can be effective and go back to our municipalities and bring forth either funding or direction and help with our staff and take input from the community. You know, as the public commenter said today, that there isn't that activism in regards to the allowance of individuals that are experiencing or homelessness or whatnot to participate. I would disagree. I think this is that platform. This is why this is. We're an advisory board to our larger boards. This is their opportunity to utilize. We are 3 hours into a meeting to participate in this discussion. And so I feel that this is where we need to continue to work for. I think we've got the CARES campus and we've got our place residents. We've got this, the SAFE camp moving in the right directions. There are going to have challenges, but that's an operations issue, not a policy issue. And I think that needs to continue. We need to do whatever we can to help bolster that and make sure if there's issues that they're being communicated, but that's their issue. And I think what we need to do here at the CHAB is look down the road. What does the future hold? How do we get individuals, to Mayor Lawson's point, to a place of permanency? How do we find the staffing and help with finding staffing? Is it volunteers? Is it donations? What can we do from that level? To Councilman Reese's point, what do they need? How can we get it for them? Those are the types of discussions we can have here, but it should be more about really helping continue to move the needle, not focus on the operations of what we have, but you know, because that's what RISE and that's what Karma Box and that's what VOA specializes. That is their job, not ours. And I can't speak to their point. I've never experienced homelessness. I don't know other than walking, talking, and visually seeing it. I have not physically experienced homelessness, so I don't know what I don't know. And so I want those individuals to help me understand that. And so this is that platform to do that. So happy to have those conversations here, but I think this board needs to continue to focus on where we can be impactful, whether that's low-cost housing, you know, whatever we need to continue to add to our community from the point-in-time counts to whatever. But that's where our focus needs to be continuing going forward.
Thank you. Councilmember Reese.
Thank you, Madam Chair, and I'll try to be brief as well. I think the item was asked, what are we looking for next agenda? And so I guess what I would say is I want to make sure that we are robustly addressing the concerns of what do we do with people during the winter, whether that is warming centers, whether that is additional tents, spaces on the CARES campus in the Old Wells Cargo Building, whatever it is we can do to prevent people from suffering and being exposed to the elements, which has incredibly long-term consequences, as we all well know. So that would be my singular thing that I think is important. As to Chair Lucy's point, I agree in principle that this is a policy concern that we've got to be addressing rather than me, Devin Reese, micromanaging what a provider is doing. I believe that when we ask those questions, we're really just directing our own accountability. So for my part, I think that is an important part of it. We're also addressing some of the concerns. But Chair Lucy is absolutely correct that we should be focusing on policy. And so for my part, to add to this discussion today, and on this particular agenda item, I think we have to agree in principle as a group and take back to our respective bodies the concept of housing being a fundamental human right and viewing housing as infrastructure. If we can do that, then each of our bodies can start to allocate resources towards that goal. And so I hope that what we will come out of this body with are a unified vision for increasing housing stock in this region. I think we're all doing it in some ways, either through affordable housing trusts, some of the work that we're doing through Reno Housing Authority, Reno Housing Authority is perhaps a misnomer because it's not really Reno. It's a regional approach. It includes some of our rural communities as well. But we have to start allocating sufficient resources to rent voucher programs, different kinds of rehousing programs, different kinds of programs that can allow people to stay housed where they are, and also building absolutely permanent supportive housing. And so I think we're having some of these conversations. I know Reno Housing Authority had a very important meeting last week, and I think a lot of good is going to come out of that group. But for me, the two issues that I want to see addressed, Ms. Hill, are warming centers and cold weather related responses, and secondarily, housing infrastructure related concerns.
Great, thank you.
Madam Chair.
Yes, Councilwoman Bybee.
Real briefly, I would just like to add my agreement with previous comments made on really, as we look at goals and objectives for this board, really the permanent housing is their ultimate goal. And I mean, it's something that that I think we all agree with, and kind of changes how we look at this whole process from, you know, our length of stay to the ultimate goal of being permanent supportive housing. And so I think that has to be what drives us, and looking at you know, innovative solutions to that. How do we find, whether it's rentals or leases or actual housing being built, or to Councilwoman Jordan's comments on, you know, alternatives, you know, tiny homes and other things that we can, it's not a one size fits all. And I think working with Reno Housing Authority, that's part of our plan, but I think that's an ultimate priority would be on the housing for sure, and very supportive of the diversion. I think Dana Searcy talked about, we don't have two huge components that need to happen, our diversion and our mental health. Actually three, the nursing also. So three things that, you know, the diversion that can keep people from entering the shelter, to the mental health component, and nurses improving safety, because safety is a huge, you know, huge concern also. But I think that those would be my priorities as we look at goals and objectives of where we're moving. And I would agree with Mayor Lawson. At the end of the day, we're an advisory board, so we are simply here to gather information, to advise our partners, and to work with all stakeholders in the community, the advocates, the agencies, all of us together, because I think together that's how we make that difference that we're all hoping to make. Thank you, Madam Chair.
Thank you. Yes, Councilwoman Jordan.
Thank you very much. And to Member Bybee's point, I think the biggest thing that we could do between now and even our next meeting is on the communication front. With this new tool, I'm just wondering if the different jurisdictions and our communication departments can begin to push this information out on a daily basis to start getting people familiar and comfortable with it being kind of the clearinghouse for up-to-date daily data on the campus. I think we spend a tremendous amount of time responding to individual questions or concerns, and it's almost like we're playing telephone, because in the time we spend responding on the one-offs, I think we could really answer globally, and everybody has the same information at the same time, could really kind of reduce the pings that all of us and various management get if we used that site. And I'll give you an example. When we first opened the campus, we would get daily emails from management at the City of Reno on real-time instances, on capacity, on issues, on resolutions, on things in the work, on timing, on staffing, et cetera. That was hugely helpful, that we could use as everybody was on the same baseline of information. So I think you've got a great tool. I would say use it more. How can we start pushing that information out so that everybody has the same information, up-to-date data? I think that would really help a lot of what we've been one-off dealing with.
Thank you. And this item is for possible action, so we need to call for public comment. Madam Clerk, do we have any public comment on this item?
We do. We have Elizabeth Pope.
Good afternoon. I'm Elizabeth Pope, and I am a licensed clinical social worker. I'm currently contracted with the county to provide case management at the Safe Camp. I've also just wanted to add to this conversation. It's been said a lot of times, but I have served people who without a place to live for about the last 20 years. And I will tell you that all the folks who are staying in the camp right now want housing. And so we find ourselves in a place where even those who are ready and wanting have no place to go. And so to hear the idea of incentivizing a program where developers would have a reason to develop affordable housing and to provide more subsidies and to provide for a more diverse housing inventory is really refreshing to me after all of the years of doing this work. Those are the only ways we are able to get people into and off of the street, or sorry, not into the street, but off of the street. I also just want to say thank you for the opportunity to try the Safe Camp out. I know that you're an advisory board, but you take all of this information back to your local jurisdictions, and it is amazing. And having been, and I'm a little nervous right now, having been in this community for so long and watching like Tent City happen a while back, in like 2009, I think it was, and not succeed very well. And then to see us have this opportunity to really construct and help folks in a low to no barrier way is really a gift. And to that point, I also want to say when we do look at housing options, the importance of making things low to no barrier. A lot of the folks that we are trying to house have a really difficult history with housing. And we may continue using substances when they move into it. And so finding flexible landlords and flexible housing options for them is absolutely critical. So that's it. Thank you.
Thank you. Okay, I would like to just add to these three items, both the permanent housing, the community-wide resources and shared data, the engagement of appropriate community stakeholders, plus I'm hearing safety of our current emergency shelters, communications to the community, and creative housing solutions. I think those may be our 5 goals, but if we're not ready to make a motion today, I understand we can continue it to another day.
Madam Chair, I'd like to continue to the next meeting.
Okay.
Let's come up with some more concrete ideas that are measurable and achievable so that we can say we've made that goal. If we just talk about safety in general, how do we know we've accomplished anything?
Okay, then we'll come up with a document, bring it something to y'all with at least these ideas included, and we can have further discussions in December. I will move now to the upcoming CHAB meetings in calendar year 2021 and 2022. I know that when one meeting is even missed, the community fills out of the loop. We heard this with October. We didn't have staff that were in town for that meeting, so that's why we canceled it. But I'm hearing that people want to have meetings monthly, so I just wanted to get some feedback from the board on that.
Madam Chair, I'd suggest that we stay with monthly meetings at least for the next year, so we can measure our goals as we set them at the next meeting. And with that, I'll make a motion that we make meetings monthly, at least for the next 12 months.
Okay. Second?
Madam Chair,
Yes?
with a little discussion prior to
Sure.
that motion. I appreciate Mayor Lawson's point in regards to having meetings and continuing to do outreach to the community and providing this as a platform for individuals to reach goals and policy. But to Mayor Lawson's point, previously, it's still an advisory board. And since it's an advisory board in the sense that we are here meeting, but it's still public meeting, open meeting, and this is a significant amount of staff time. It's a significant amount of our DAs and clerks' time to be here. And as you see, we've sat here now for 3 hours with staff focusing on issues that need to be addressed, agreed. But to do them every month, and you're not going to have the amount of time in between months to put these meetings together and have those updates and compile that, when Ms. Searcy should be focusing on her programs. Ms. Thomas and Mr. Denton should be focusing on their programs operationally. I disagree that we need to be meeting every month. I think we need to meet every other month, probably, but every 2 months, once every 2 months, to discuss the issues. 6 meetings a month should be significant enough to have those discussions and really see them come to fruition. But to meet every month, we're not writing policy. We're providing direction to our communities, but unless we have time to see actual changes, it's tough for us to continue to do that. So I can't support having a meeting every month because I don't feel that the outcome is going to be that fortuitous than having them once bi-monthly. So. Yep.
So yes, Councilwoman Jordan.
Thank you very much. I actually think having monthly meetings is valuable for the sharing of information, particularly as we get through the winter of this first opening of the Nevada Cares Campus. But I suppose this board still has the opportunity in a few months, if this dashboard and communication gets to a point where it's more robust and the information is getting to the community and back and forth, then maybe we can change it at that time. But I do think still with the newness of the campus, this has become, even though this board doesn't have any real decision-making authority, it really has become a clearinghouse for information. It clears up some misinformation, it provides some information, it provides some transparency. I think for a period of time, with the understanding, it is a heavy lift on staff. I get it. We did it at Reno for quite some time. I understand it. And I think the community will understand if something is still being worked on. I don't think we're going to skewer somebody if something is still being worked on and it's not a checked box by the next meeting. But I do think it offers an update opportunity, unless and until we get the dashboard more familiar and used. So I'm kind of in the middle. I feel like for the next few months, I think we should continue with monthly meetings, but always open to modifying that if the need diminishes.
So, Madam Chair, just to continue off of what Councilwoman Jordan pointed out, I think that she's right. There are things that we need to continue to discuss, but a bi-monthly meeting schedule with the opportunity that you and the Vice Chair could call special meetings as needed to address certain things, as I have done with the RCVA board. I allow time in between. We have bi-monthly meetings for RCVA, but call meetings as necessary to convene, to get input. If we're hearing there's something that needs to be addressed, something that needs to be concerned, i.e. the winter months and warming shelters and what we are doing with that and how we're addressing that, and until the campus is completely secured and we feel that that's operating. But once again, that's an operational thing and not much we can change here at this board other than providing input back to our staff from the community. So those are my thoughts, and I see where the other two members are coming from, Mayor Lawson and Councilwoman Jordan, but I just have a different feeling about it. Thank you, Madam Chair.
Well, we have a motion for.
Madam Chair.
Yes, Councilwoman Bybee.
Just to weigh in on this, I think for right now, whether that's maybe not necessarily 12 months, but for the next, several months, with everything being so new and everything being so fluid, there is so much going on. The meeting every other month, I understand, I totally get the staff side of it, and I'm sensitive to that. But meeting every other month is a long amount of time, and calling special meetings can resolve an issue that comes up, but it's also very hard to get in on all of our calendars, let alone to get in on the calendars of the staff and stakeholders or the advocates that are trying to come before us and keep on top of it when we're calling special meetings with a week's notice or something. So I think for the time being, for the next few months anyway, with as much as we have going on and many decisions and major things that are happening, I think a monthly meeting I would support with revisiting this in the next 3 to 4 to 5 months and see if things are pretty calm and we feel we can move to every other month at that time, I would support that. But for right now, I think the monthly meetings are valuable and necessary for the business that you're. Thank you.
Thank you, Councilwoman Bybee. Just a moment, Mr. Chairman. I know Councilman Reese had something to say.
Thank you, Madam Chair. Yes, I certainly believe monthly meetings are appropriate and called more often at the discretion of the chair. But I just want to say I push back a little bit on the concept that we are just an advisory body, in as much as many of the things that we have accomplished together regionally have come out of this body, right? So the ILA, for example, the quick movement through that, many of the things that we do here ultimately come to pass as policy choices as we go back to our various entities and do the work that we're doing. So the work we do here is meaningful and valuable in my mind. And I just think that happy to stay the course with monthly meetings and called more often as needed.
Thank you, Mr. Chairman.
Thank you, Madam Chair. I don't disagree with Councilman Reese. This is what I would proffer, that we stay monthly and revisit this in March after the first of the year, see how the winter months go to address this. Councilman Reese makes a very prudent point that a lot of things that would not have come to fruition had this board not convened in the time of need. So we wait till March and revisit this in March. But I would also ask then, if we do so, if we could cap a time limit of 2 hours for these meetings, and if we can't get to an agenda item, that it would be rolled to the very next meeting for discussion. Just at the respect of staff and timing and what it takes to do these meetings, I would ask for that respect.
I hear you, and I think as your new chairwoman, I feel guilty that we're running over our noon deadline that was originally scheduled for this meeting. So I'm sorry about that. And the vice chairman and I will work out a agenda that is a little bit more realistic for the next meetings. And thank you for that input. So is that a motion,
Well,
Mr.
you have a motion on the floor, and I was.
I'll amend my motion
Okay.
to reflect Chairman Lucci's points.
Second.
All right, all those in favor?
Aye.
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 Okay, that's all of us. Thank you very much for that. I'm so sorry, Madam Clerk, did we have public comment on that item?
No, not on item
Okay,
7.
great. Next up is the board member announcements, reports, and updates to include requests for future board agenda items. Anything from the board?
No, Madam Chair.
Okay, and then, yes, next up, number 9 for public comment. Comment heard under this item will be limited to 3 minutes per person and may pertain to matters both on and off the board agenda. Madam Clerk, do we have any public comment?
We do. We have Lily Barron up first.
Hello again. Good afternoon this time. My name is Lily Barron. I just wanted to address some of the things that I heard in this meeting. I appreciate everyone for meeting for 3 hours. In my opinion, 3 hours is not enough time to address the multitude of issues that were just presented by Mr. DeCarmine, who I had the pleasure of meeting with several times to give recommendations to the city months ago. And many of those recommendations were made again today, and they were made in meetings with you and also with Ms. Cersei. So I hope that they are taken into consideration and used, because he is the expert on this subject and has used a model that works. So I would really like to see everyone trying to do something that works. The number one thing that he said that stood out to me was, CARES campus is not safe. To which Ms. Cersei turned around and said that safety is the reason that she does not want other people going elsewhere off of the CARES campus. So that to me is an extreme conflict of ideologies. December 11th is an absolutely unacceptable amount of time to make people wait to have adequate housing or even emergency housing, especially because when I spoke with Ms. Cersei 2 weeks ago, she said the end of November. So I'm just wondering what I should tell the other people that live in my neighborhood outside, as far as what they can do, the women that are living right across the street from me. I'm actually in Miss Jardin's district, which is really interesting because you probably can't see my house from her infinity pool. The other thing that I would like to mention is that the motel program is one of the most easy, the motel program and the CAC are some of the easiest solutions for these issues, especially for women who, once again, from the expert that you hired, said are not safe in the current facility. Another thing is that Mayor Lawson, you referred to this as a business. It's not a business, it's a service. If it's a business, then we have more problems. And then I really take issue with comparing a Starbucks worker to somebody who endures trauma prolonged at their job, such as working at something like an emergency shelter. How dare someone compare someone who makes lattes to someone who's doing triage for people experiencing the worst periods of their life. That's absolutely ridiculous. And $16 an hour, $18 an hour is not enough. Most of you make over $100,000 a year. You have over 100 employees that make close to $250,000 a year. So I think it's time for everybody to take a pay cut and figure this out. Thank you.
Our public commenters, these comments need to be made to the board as a whole, not to individual board members. I will take the next public comment.
Next up, we have Jake Maynard.
Hello again. So basically, I'm getting mixed messages on this board and its purpose and what your capabilities are. So this board is has been expressed to be receiving information and transferring that information to your respective councils or positions and putting that into direct policy contributions. If you are not willing to come to a meeting once a month and receive that input, which we don't really have another funnel or public forum of giving that input at this time, if you are not able or willing to hear these public comments or receive feedback, then basically I don't believe that you should be on the board. And also another point, each of you do have power in your respective bodies to put forth policy, to put forth actual things that can go into law or otherwise. And so the charade of you saying, oh, we can't do anything, we don't have any power to do something is frankly just disrespectful. I want to reiterate that housing, supportive housing, permanent supportive housing, and or affordable housing must come first before any limits on a stay at CARES campus, just clarifying that. I'd also like to express concern with a statement that Ms. Searcy made regarding discouraging unhoused people from entering the downtown area when discussing the Record Street shelter. Okay, homeless, unhoused people, whatever, are members of our community as much as anyone else and should not be corralled into any one area or any one zone as they have been. The services such as the downtown library are some of the only locations in which public internet access is available. So there are other services in places such as public parks, and we should not limit or try to discourage any movement of any community member within our community, period. And I will be waiting for all of you who have expressed support for affordable and permanent supportive housing to put the money where your mouth is and enact and spearhead in each of your respective bodies actual plans and we will make sure that you follow through on these promises. Thank you.
Next up, we have Bill Sims.
Hi guys. So I basically just wanted to come back real quick for two things real quick. First off, what Dennis said about hiring social workers at $13 to $15 an hour is insulting. I've had a mental health worker. She's had to literally, factually save my life. She's had to help me from not cutting myself. So for Dana to say, well, we're hiring at $13 to $15 an hour, and we had that right to expect that social workers should be willing to work for that kind of income, is insulting. It really is. My second point is about the comments that were made that this is a platform that you guys don't need people that actually are currently homeless here on the advisory board. False. Because this right here, this is a one-way street. You're not going to talk back to me. You're not. He is not. No one is. It's a one-way street. Correct? There's my proof. So to say it's a platform is completely false. And on top of that, if you're going to say we only need to meet one time every other month, right as we go into winter in Nevada, you don't care about human life. You don't. And if you can't take time one day out of the month for 3 hours to talk about helping your neighbors, get off the board. There's the door. Get off the board and don't look back. Because in my book, when you do that, you look at people like that, you are scum. You're looking at those people the same exact way you look at me. The only difference between them and me is the fact that I just happen to be lucky enough to already be on low-income housing. Other than that, I am in the same boat as these people. So if you can't take 3 hours, one day out of the month to actually help these people, you don't need to be on the board, period. You really don't. You're scum if you think that doing this once every other month is enough when we are factually going into winter.
Madam Chair, if nobody else signed in.
Okay, thank you everyone for your work and time today. I will call the CHAB meeting to adjournment.